Thank you very much. I would like to begin by announcing some important developments in our war against the Chinese virus. We'll be invoking the Defense Production Act just in case we need it. In other words, I think you all know what it is, and it can do a lot of good things if we need it, and we will have it all completed, signing it in just a little while, right after I'm finished with this conference. I'll be signing it. It's prepared to go. So we will be invoking the Defense Production Act. Last week I signed an emergency declaration under the Stafford Act, which, as you know, we invoked previously, and which activated FEMA's National Response Coordination Center. FEMA now is fully engaged at the highest levels. Today, FEMA is activated in every region. We are at level one being the highest level, which we will work with, and we've been working with FEMA. I've done a lot of work with FEMA. They're incredible. It's always been on hurricanes or tornadoes. They're right now in Tennessee, a large group working in Tennessee have been incredible. It was a tragic event. Alabama last year, also a tornado, and then obviously the numerous hurricanes in different locations that were, in some cases, very devastating, and in every case, FEMA came through. This is a very different kind of a work for FEMA, but they will come through, as they always do. We have tremendous people, tremendous talent in FEMA. We're sending, upon request, the 2 hospital ships. They're being prepared right now. They're massive ships. They're the big white ships with the Red Cross on the sides. One is called the Mercy and the other is called the Comfort, and they are in tip-top shape. They soon will be. They're getting ready to come up to New York. I spoke with Governor Cuomo about it. He's excited about it. And I also, we haven't made the final determination as to where it's going to go on the West Coast. The Comfort is located now in San Diego, and it's going to be, we'll be picking the destination fairly shortly. So those 2 ships are being prepared to go, and they can be launched over the next week or so, depending on need. Earlier this week, the first clinical trial of the vaccine candidate for the virus began in Washington State, as you probably know. The genetic sequence of the virus was first published in January, but thanks to the unprecedented partnership between the FDA, NIH, and the private sector, we've reached human trials for the vaccine just 8 weeks later. That's a record by many, many months. It used to take years to do this, and now we did it just in a very short while. That's the fastest development in history of what we're doing with regard to the vaccine. We're making very, very big progress. Today I can announce further steps to expand testing capacity. We're working with several groups to determine if the self-swab, a much easier process than the current process that's not very nice to do, I can tell you, because I did it. But we have a current process that's a little bit difficult. If you have it done, the groups are working on determining if a self-swab by an individual is as effective as the other. The other is very effective, very accurate. But we're going to see if we can do a self-swab, which is would be a lot more popular, I can tell you that. So, and that would be administered also by a health official, but it would be a lot easier to do. The fact is that the health professionals would free up a lot. Let me just say, the self-swab is what it is. It's a self-swab. You do it yourself. The other has to be issued by a health professional, and it's something that is quite difficult. And we think it's working out for the self-swab. And if it would test positive, the people would go and they would do what they have to do. But we think that's probably working out. I've asked the FDA to cut through the red tape and reduce regulatory barriers. We are looking at some very exciting things, and I'm going to be holding a second news conference either today. We're going to talk about the FDA. Some things are happening that are quite exciting, and we're going to be doing that either later today or tomorrow, fairly early tomorrow. So we'll see what happens. But the FDA, my instructions is I've been working very, very hard on a number of developments, and we'll be discussing them with you later today or tomorrow. And this afternoon, I'll be meeting with nurses on the front lines of the battle against the virus. They're truly American heroes. They want to get it done. They're incredible people. So we're going to be meeting with nurses, and I actually look forward to that. They're very brave. They're taking a lot of risk, and they have done an incredible job, and they never complain. Today, I'm also announcing that the Department of Housing and Urban Development is providing immediate relief to renters and homeowners by suspending all foreclosures and evictions until the end of April. So we're working very closely with Dr. Ben Carson and everybody from HUD. Every generation of Americans has been called to make shared sacrifices for the good of the nation. In World War II, young people in their teenage years volunteered to fight. They wanted to fight so badly because they love our country. Workers refused to go home and slept on factory floors to keep assembly lines running. And, you know, the numbers of ships that they built during World War II to this day nothing like that has ever been equaled. They were doing ships literally on a daily basis. Nobody's ever seen anything like it. And to this day, nobody's seen anything like that, what they were able to do during World War II. And now it's our time. We must sacrifice together because we are all in this together, and we'll come through together. It's the invisible enemy. That's always the toughest enemy, the invisible enemy. But we're going to defeat the invisible enemy. I think we're going to do it even faster than we thought. And it will be a complete victory. It'll be a total victory. So we'll have a second conference, again, having to do with the FDA and this. I think it's going to be potentially a very exciting news conference, and we will do it as quickly as we can, so whether it's today or tomorrow. And I'll, with that, ask Mike Pence to say a few words, and thank you very much.
Thank you, Mr. President. The White House Coronavirus Task Force met this morning, and now that we have cases in all 50 states, we're continuing to move out on the President's call to bring the full resources of the federal government, a full partnership with every state and territory, the full power of the American economy to support businesses and families. As the President says to us and every day, we'll do whatever it takes. We're all in this together. Yesterday, the President met with the tourism industry executives and also had an engaging discussion with all the top companies in our industrial and medical supply chain. The President, as you all are aware, also announced today that by mutual consent, the northern border to Canada will be closed to non-essential travel. This does not include essential travel or the transit of goods, but it was through mutual discussion that took place this morning between the President and Prime Minister Trudeau, and the Department of Homeland Security will be effectuating that decision. The President spoke with some of the nation's top business leaders today, again, to speak about the supply chain in the country. For our part, we're going to be conducting a conference call later today with state and local health officials to renew our ongoing commitment of cooperation and collaboration. As the President said last week in signing the Stafford Act, he stood up the National Response Coordination Center, and today at the President's direction, FEMA has gone to level 1. FEMA's mission is to support disasters that are locally executed, state managed, and federally supported. And tomorrow, the President will be hosting all the nation's governors from a video conference at FEMA to ensure that they have a full connection to all of the activated regions for FEMA going forward. With regard to testing, I'm pleased to report that we're increasing the number of tests being performed by the thousands every day, thanks to the public-private partnership that President Trump forged with commercial laboratories around the country. Our health experts tell us to remind every American, it's important to remember, people without symptoms should not get tested. We want to make sure that the supply of testing is there for those that need it most or are symptomatic or in the vulnerable population. Dr. Deborah Birx in a moment will address the progress that we're making on testing, the infection rate, our recommendations to every American, as well as some important new findings about the impact on youth that we're gaining from data that's coming in from Europe that'll be important to every American. On the subject of supplies, the President has our task force extremely focused. As the President mentioned mentioned that he's invoking the Defense Production Act today. Secretary Esper in a few moments will describe the ongoing efforts that the Department of Defense is taking to make medical resources available. Secretary Robert Wilkie will announce decisions the VA has made to expand hospital capacity within their system. Also, with regard to medical personnel, at the President's direction, HHS is issuing a regulation today that will allow all doctors and medical professionals to practice across state lines to meet the needs of hospitals that may arise in adjoining areas. In addition to that, we are again today asking every American and our medical community leaders and hospitals to partner with us in delaying elective procedures across the country in our healthcare system to ensure that medical supplies and medical capacity go where they're needed most. Seema Verma will describe guidance that CMS will be issuing on that front. And finally, I want to remind every American of the President's 15-day guidance to slow the spread. We are grateful for members of the media and the general public that are adhering to these, sharing them with neighbors and friends. All of our experts continue to believe that if every American will do their part and embrace and put into practice these principles, that we can significantly limit the reach of the coronavirus in the weeks and months ahead. Thank you, Mr. President.
Thank you very much. Dr. Birx, please.
Thank you. Thank you, Mr. President, Mr. Vice President. So, we continue to look at data every single day. There are concerning reports coming out of France and Italy about some young people getting seriously ill and very seriously ill in the ICUs. We think part of this may be that people heeded the early data coming out of China and coming out of South Korea that the elderly or those with pre-existing medical conditions were at particular risk. It may have been that the millennial generation, our largest generation, our future generation that will carry us through for the next multiple decades, there may be disproportional number of infections among that group. And so even if it's a rare occurrence, it may be seen more frequently in that group and be evident now. So we're looking at that information very carefully. We have not seen any significant mortality in the children, but we are concerned about the early reports coming out of Italy and France. So again, I'm going to call on that generation that's part of that group that brought us innovation, particularly throughout all of their ability to look around corners and skip through games. I always went level by level. I didn't realize that you could go from level 3 to level 7. That's what they've taught us. They look for things that we don't see. We need them to be healthy. So again, not only calling on you to heed what's in the guidance, but to really ensure that each and every one of you are protecting each other. And so we cannot have these large gatherings that continue to occur throughout the country for people who are off work to then be socializing in large groups and spreading the virus. You have the potential then to spread it to someone who does have a condition that none of us knew about and cause them to have a disastrous outcome. Finally, on the testing piece and what we're learning, I know you know last week in bringing the private sector, I think what has been exciting to me over the last 2.5 weeks is to see this administration harness the full capacity of the private sector, understanding that a lot of our solutions that we need to confront this virus rely on the private sector. Bringing the private sector commercial labs was critical into this process. We are now beginning to see that they have spread out in a prioritized way because we asked them to prioritize the regions that were mostly affected. And so you still may have difficulty getting tests in areas that do not have significant cases. We've had them prioritize the regions where we need diagnosis and their diagnostic percent. Remember I told you South Korea was under 4%, so 96% of people were negative. The last report we've seen from the laboratories have about a 7+% positivity rate. Still 93+% or 92% are negative. But I think that's encouraging to me personally that we're prioritizing appropriately to those areas that have the greatest need. Today and yesterday, Thermo Fisher pushed out most of their laboratory testing capacity, and that will dramatically increase that platform and the ability to run additional tests in addition to Roche. So I appreciate everybody's attention to these numbers. I'm excited that we've prioritized where the need was the greatest, but again, please follow the guidance and please make sure in every report that you're putting out that you're talking about the presidential guidance to actually stop the spread of this virus. Thank you.
Thank you, Deborah, very much. Mark, please.
Sure. Thank you, Mr. President. So good afternoon, everyone, and I want to provide an update on DoD's coronavirus efforts as we continue to focus on our three priorities. That's, first of all, protecting our personnel and their families. Second, safeguarding our national security mission capabilities. And third, of course, supporting the administration's whole-of-government approach. First of all, though, I do want to assure the American people that the United States military remains ready and capable of defending the country and our interests abroad. Now, with that, the Department is leaning forward in our response to COVID-19. We have issued international and domestic travel restrictions to all DoD personnel and families that should dramatically reduce potential exposure to the virus. Those have been in place for some time now. As I announced yesterday, the Department of Defense will make available up to 5 million N95 respirator masks and other personal protective equipment from our own strategic reserves to the Department of Health and Human Services for distribution. The first 1 million masks will be available immediately. We're also prepared to distribute to HHS up to 2,000 operational deployable ventilators for use as needed. Yesterday, I was at Fort Detrick, Maryland, which is probably the military's premier research institute, where I got updated on the incredible work our people are doing as part of the interagency team to work on vaccines and therapeutics. They are making great progress there. We also have announced that we've certified our 16th lab, or will soon certify our 16th lab to help with processing tests from across the country. Additionally, I have directed, as the President mentioned, that the hospital ships Mercy and Comfort be prepared to deploy to increase the nation's medical capacity. And we have also alerted a variety of field and expeditionary hospitals to be prepared to deploy as well as needed, based on direction from the Commander-in-Chief. Today, leadership from the Army Corps of Engineers is in New York, meeting with Governor Cuomo and his team. I spoke with Governor Cuomo yesterday, and other governors I will be speaking to more in the coming days to make sure that they know what DoD can provide through our system to address their needs. In my conversations with governors and members of Congress about DoD's resources, I've made it clear that we will continue to support the administration's comprehensive efforts and the country every step of the way while ensuring our nation's security remains the top priority. I want to conclude by thanking again all of our service members and their families who have been affected by this outbreak. They are all great heroes. We are continuing to support them throughout this. We are all in this together. Thank you all very much.
Thank you very much, Mark.
Thank you. So yesterday, the President made a very important announcement about telehealth, and this is allowing our 62 million seniors to be able to get some medical services from the safety of their home, reducing their risk and without any copays. But we're also making sure that the healthcare system is prepared and that those on the front lines have the support that they need. The reality is the stakes are high, and we need to preserve personal protective equipment for those that are on the front lines of this fight. And to that end, we have put out guidelines over the last 2 weeks to expand the types of masks that can be used in routine care and saving those N95s for the most risky situations. Conserving personal protective equipment is also essential to combat the virus. So today, CMS will announce detailed recommendations to further promote this needed conservation, specifically by limiting non-essential elective medical and surgical procedures, including dental procedures. We believe that these recommendations will help surgeons, patients, and hospitals prioritize what is essential while leaving the ultimate decision in the hands of state and local health officials and those clinicians who have direct responsibility to their patients. And we urge providers and clinicians and patients to seriously consider these recommendations. They will not only preserve equipment, but it also allows doctors and nurses to help those that are on the front lines. And it'll protect patients from unnecessary exposure to the virus. We fully appreciate that this is going to have a major impact on the healthcare system, but the shared sacrifice is essential to help those that are on the front lines. And I want to thank the medical societies such as the American College of Surgeons and the American Dental Association that took a proactive approach and already posted these recommendations. And we've also talked to the American Medical Association, and they have fully indicated their support for this recommendation. We now invite the entire healthcare community to join us in this effort. Thank you.
Thank you very much. Robert, please.
Thank you, Mr. President. My instructions from the President were very clear. I was to do everything imaginable as aggressively as possible to protect the 9.5 million veterans who are part of the Department of Veterans Affairs. Last month, we established 19 emergency operations centers across the country. We began to limit the number of visitors who entered our facilities. We began, I think, we were the first system to begin triaging across the country in our 170 hospitals, the entrance of anyone into our facility without being questioned or tested. We expanded those restrictions to those in our 135 community living centers, which have about 7,800 veterans who are in acute conditions, to make sure that they were protected. We also took the next step and made sure that we limited the dental surgeries that we were provided. We've cut back by 1/3 the number of routine appointments we have had, and we have canceled elective surgeries. These were all part of the President's directive to be as aggressive in a public health sense as we could be. And I think we have set the pace for the entire country. I will say, we've often said that we work the most noble mission in the federal government. Our veterans have been in the toughest spots in the world. They have been put in conditions that are unimaginable to most Americans, and they have responded. They have responded clearly. They have responded with passion, and also the 400,000 members of our department who are out there on the front lines. The last thing I will say is that you have heard a lot about the fourth mission that VA has. Our first three missions are health care, benefits, and memorial affairs. Our fourth mission is to support the federal government in times of natural disasters and pandemics. We are the buttress force in case that FEMA or HHS calls upon us to deploy medical professionals across the country to meet crises. We plan for that every day. We are gaming out emergency preparedness scenarios, and we stand ready when the President needs us to expand our mission. Thank you.
Thank you very much, Robert. Thank you. Thank you all. That's very nice. Any questions, please?
President, thank you. Two questions, if I may. Your Treasury Secretary was on Capitol Hill talking about the potential for what could come, and he said that unemployment could skyrocket to 20%. Are we looking, that could rival the Great Depression? Are we looking at potentially historic
No, well, I don't agree
devastation?
with that. Yeah, no, I don't agree. That's a absolute, total worst-case scenario. But no, we don't look at that at all.
And thank you. And my second question.
We're nowhere near it.
Okay, why do you keep calling this the Chinese virus? There are reports of dozens of incidents of bias against Chinese Americans in this country. Your own aide, Secretary Azar, says he does not use this term. He says ethnicity does not cause the virus. Why do you keep using this? A lot of people say it's racist.
It's not racist at all, no, not at all. It comes from China. That's why. It comes from China. I want to be accurate.
About Chinese
Yeah,
Americans
please,
in
John,
this country?
please.
The aides behind you. Are you comfortable with this term?
I have great love for all of the people from our country, but as you know, China tried to say at one point, maybe they stopped now, that it was caused by American soldiers. That can't happen. It's not going to happen, not as long as I'm president. It comes from China. John, please.
Two questions, if I could, Mr. President. First of all, in the Defense Procurement Act, you're invoking it today. Senator Schumer
Yes.
said on the floor a short time ago that it urgently needs to be put into action to produce medical supplies, particularly ventilators. Do you have some targets that you would like to see immediately spooled up under the act?
We have tremendous numbers of ventilators, but there's never been an instance like this where no matter what you have, it's not enough. That would be the case. And we will be, it's being signed, it's essentially drawn, and I'm going to sign it in just a little while. If we need to use it, we'll be using it at full speed ahead.
Sorry, he says it's urgently needed to be used. Do you have some
Well,
targets?
we're going to know whether or not urgent, but we will, yeah, we do have targets. We have targets for certain pieces of equipment. We have targets for masks. You know, the masks, the numbers of masks are incredible. We've ordered millions of them, but we need millions more. A thing like this has never been requested, and we've never had to even think in terms of these numbers, but we need millions of masks, and all of that will be ordered. We need respirators. We need ventilators is a big thing because it's a complex piece of equipment. So we have a lot of ventilators, but we're going to be ordering more.
And the second question, what size will the checks be that will be sent out to Americans?
To be determined. We're working with the Senate right now. We're working with everybody on Capitol Hill. There's been tremendous, there really has been, I mean, with some exceptions, obviously, because it's always the way it is, but there has been, they've been getting along very well, Republicans and Democrats. It's a nice thing, very bipartisan so
Would you
far.
like to see them more than $1,000?
Well, we're going to see. I don't want to get into that right now, John. We are looking at different numbers. We're looking at timing that would be different, splitting the time, splitting the payments. We're looking at a lot of different things. Hasn't been determined yet, but it will shortly be determined, and people want to go big as opposed, everybody seems to want to go big, and they want to get to the recovery. The big day is, the big thing we can do is get rid of this horrible, I call it the unseen enemy. You call it, there's 1,000 different terms for it, but whatever, it snuck up on us. And it did 128 countries. I think it's in something like that, very close to that. Think of that. So it spreads violently. It's a very contagious, very, very contagious virus.
Do you consider America to be on a wartime footing in terms of fighting this virus?
I do. I actually do. I'm looking at it that way because, you know, if it got out of control, the big thing we did was a very early stoppage of people coming in who could be very, very heavily infected. That was a very good move, and it was very early, very, very early, when most people, including a lot of professionals, they didn't want us to do it. That really saved a lot of lives, and yeah, I look at it, I view it as in a sense, a wartime president. I mean, that's what we're fighting. I mean, it's a very tough situation. You have to do things. You have to close parts of an economy that 6 weeks ago were the best they've ever been. We had the best economy we've ever had. And then one day you have to close it down in order to defeat this enemy. And but we're doing it, and we're doing it well. And I'll tell you, the American people have been incredible. For the most part, they've been really incredible. Yeah, please, Caitlin.
For you, and then I have one for Secretary Wilkie as well, but I'll start with you. You just said there are a tremendous number of ventilators that we have, but for weeks, hospitals have been warning about a critical shortage that they say we are not prepared for. So why did it take so long to invoke the Defense Production
Well, you know,
Act?
hospitals are supposed to have ventilators too. And when we have thousands of ventilators, it sounds like a lot, but this is a very unforeseen thing. Nobody ever thought of these numbers. Nobody ever saw numbers like this. Even with regard to testing, normally we wouldn't be doing testing, and they decided to do it. Very, very hard to ramp up. Now we're getting highly sophisticated tests, and it's going very well, but nobody's ever heard of testing in the kind of quantities that you're talking about.
But we knew for weeks we needed more ventilators. So why did it take so
Well,
long?
we knew. It depends. It depends on how it goes. Worst case, absolutely. Best case, not not at all. So we're going to have to see where it goes. But we are ordering thousands and thousands of ventilators, and they're complex. These are complex machines, and but we're ordering them. Does anybody have Mike? Maybe you do. How many do we have?
Yeah, you said
And
you
we're
could
ordering.
access the
Please,
number.
yeah, please. Do you know the number?
We have a specific number of ventilators in the stockpile. It's in excess of 10,000, and you just heard the announcement from the Department of Defense. They'll be adding several more thousand to that. But President, even this morning and yesterday afternoon, speaking with the largest companies in the supply chain in this country, we're hearing a tremendous spirit among industry leaders who are ready to step in and add to that volume. The stockpiles don't count all of the ventilators that exist today in the marketplace and in healthcare facilities around the country, but the President's given us a directive to make sure that our stockpile, but just as importantly, working with industry leaders, that we're securing the increase in ventilators, the increase in masks, gloves, eye protective care, garments that are all necessary to lean forward. And we're confident we'll be able to accomplish that with the incredible cooperation of the supply chain that exists in America today.
But we don't have an exact number for nationwide, how many ventilators we have?
We can give you that exact number. We'll give it to you.
that's what-
But we're ordering a lot more.
Okay, sorry.
Yeah, go ahead in the back,
One
please.
question for the VA secretary? I have one question for
Yeah,
the
one
secretary.
second. 1 second, Caitlin. We'll do it in a second.
Okay.
You'll be able
That's
to.
important.
Two questions, Mr. President. Thank you.
Yes.
The first one on the Canadian border. What was the tipping point? Friday we talked about it, and Monday you said no, we're not considering closing
No, I
the
said not
border.
yet. I spoke with the Prime Minister, Trudeau. Very good relationship, obviously, between us and our two countries. And no tipping point. It's just that we want to isolate from the standpoint we don't want people coming into contact, because that's the way we're going to win this war. That is so important. And we both thought it was time. Now, it's not affecting trade. It's non-essential. It's non-essential crossings. It won't affect trade at all. And it was just something we thought would be good for both countries. Yes, please.
Second question, Mr. President. How can you be sure that trade
Go ahead,
is not
please.
going to be a vector of the virus? How can you be sure that trade and everything that's being shipped from one side?
Well, they're doing it in a very careful manner. You can only be vigilant and very professional, but it's not pertaining at this moment to trade between the two countries. Yeah, please.
We are hearing that the $1 trillion economic stimulus package could look something like $50 billion for the airlines, $150 billion in loan guarantees for critical sectors of the economy, a $250 billion payment on April 6th directly to individuals, another $250 billion payment on May 18th, again, directly to individuals, and as well, $300 billion for small business loan guarantees. Is that, in the general sense, what you're looking at?
It could be, and we're also playing with a lot of numbers, a lot of very big numbers, and a lot of very small numbers, frankly. We want to take care. We have to help everybody. It was nobody's fault. This happened. I mean, some people could say it was somebody's fault, actually. But it was nobody's fault, and certainly none of these companies that all of a sudden had no passengers in planes and had no passengers on cruise ships and all of the things that have happened. But I will say that they can't be blamed for this, and we want to keep those companies vibrant, because there's going to be a comeback very, very quickly as soon as this is solved, and it will be solved. We will win, and there will be a comeback, and it'll take place very quickly.
$250 billion, there's give or take 330 million Americans or so. If you just do the math on that, that's about $750 a person, a family of four. That would be about $3,000 on average, again, rough math. Is that where this is headed?
Well, no, I don't want to say that, because it's a moving, these are all, every number that you mentioned, yes, we've talked about those numbers. We're also moving those numbers in both directions. So we'll let you know. It's moving along fast. Again, there's a great bipartisan effort going on that I haven't really seen before to this extent.
On the self-swab that you mentioned at
Yeah.
the beginning of this, has the FDA approved that test?
No,
Is
they're
that what
looking
you're
at it.
waiting for?
It's down the line, and they're looking at it very seriously. And I think it would be a great thing, because the others, to use a nice word, it's very inconvenient.
And a
It's
second
very
question
tough.
for you, sir. You tweeted this morning about your approval rating amongst Republicans. You have said that you give yourself a 10 in terms of handling this crisis. How do you reassure Americans at home who don't trust you to handle a crisis of this magnitude?
Well, I think we're doing a really good job. We started off with a termination of the border, the people coming in from China, where this all started. That meant I took it very seriously. And when I use the word calm doesn't mean that I'm not taking it seriously. Calm means, and we should be calm, we should be extremely calm. But, yeah, 95% within the Republican Party and over 50%. And I also have, we have very great approval numbers. I mean, people like the job that we're doing. And when you compare this to other epidemics, or if you want to use a different term, you can, but within this country, and you look at what's happened over the years, this is being handled very, very professionally. We have the greatest professionals in the world. We're doing a good job. Nobody's ever been swamped like this. And nothing's been so contagious. The level of contagion has been incredible, actually. Nobody's seen anything quite like this. Yeah, Peter, go ahead.
If I can ask about the tests, sir, for a second. If federal officials have shipped millions of tests, as you and your colleagues have said, why, as the federal government says, have only 59,000 tests been processed to this point? We just heard from the Atlanta public health director saying that they have fewer than 50 test kits for more than 900,000 citizens.
Yeah,
Where are
well,
the tests?
I'll let Mike answer that.
So that's a very critical question, and thank you for asking it. So the test kits that we put out last week through the approval, the rapid movement of that meeting that President Trump called less than 2 weeks ago, that has resulted in bringing our private sector to the table, because the test and the platform that was out there could only run between 4 and 12 tests per platform per day. We've now moved into platforms that can run basically tens of thousands of tests per day. So the reason I'm grateful for your question, because it allows me to point out that, of course, then there was backlog. There were individuals who had been tested, who hadn't had their specimen run because of the slow throughput. It's now in a high-speed platform. So we will see the number of people diagnosed dramatically increase over the next 4 to 5 days. I know some of you will use that to raise an alarm that we are worse than Italy because of our slope of our curve. To every American out there, it will be 5 to 6 days worth of tests being run in 24 to 48 hours. So our curves will not be stable until sometime next week. The reason I talked about Thermo Fisher yesterday is because their platform is in 2,000 laboratories. They're the ones that are putting out the 1 million tests this week that will solve the issue that Atlanta and others have brought up. I wanted to be clear. We prioritize the areas. We do county by county analyses. Based on those analyses, on what counties had more than 50 cases, we prioritize the test kits we put out, the 400,000. And that's why we're seeing a 7% plus positivity rate. We'll be able to expand that platform and reprioritize based on the accessibility of the other kits.
Mr. President, perhaps I can follow up. How are non-symptomatic professional athletes getting tests while others are waiting in line and can't get them? Do the well-connected go to the front of the line?
Well, you'd have to ask them that question. I mean,
Should that happen?
I've read. No, I wouldn't say so, but perhaps that's been the story of life. That does happen on occasion, and I've noticed where some people have been tested fairly quickly. Look, we inherited
Will you encourage them to defer their tests to others?
Excuse me. We inherited a very obsolete system. This was a system that was out of date, obsolete, or it was a system that was never meant to take care of the kind of quantity, the number of people that we're talking about, millions and millions of people. If you go back in years past, like even recently with the flu, nobody had tests before. They didn't test the entire nation to see whether or not they had flu. They got the flu, they got better. Hopefully they got better, that was it. Now all of a sudden they do this very complex testing. What we've done is we've broken it down, we've broken up the system, but it was obsolete, and or you could say it was also a system that just wasn't meant to handle the kind of volume that you're talking about. We've rebuilt it into a system that for the future will be a very good system if you want to go this route. But this was never done before, and I would imagine it will be done in the future, but we built it into a very good system by using private companies, the great private companies. And I have to say Roche has been doing a very good job. They're doing a lot of work, a very good job. But this was an obsolete system. This was not a system that was meant to do anything like this or even near this. John?
Mr. President, a couple of things. A major trade coalition is calling on you to suspend tariffs with other countries as part of the response to the coronavirus.
Who heads that group? Those countries do, probably.
No, it's an
Go
American,
check.
it's an American free trade.
I know, I'm sure of free trade. Look, China's paying us billions and billions of dollars in tariffs, and there's no reason to do that. They haven't even spoken to me about that. China hasn't asked me to do that, but we're getting billions of dollars a year from tariffs from China, and I can't imagine Americans asking for that, but it could be that China will ask for a suspension or something. Let's see what happens. China's having a very rough time. They have their worst year in 76 years, as I understand it. They're having a very, very tough time, and then on top of it, this happened with the virus. But no, we're taking in billions of dollars a year in tariffs, and this was caused by something totally unrelated to tariffs.
And on asylum seekers and people who cross the southern border illegally, are you planning to invoke 42 U.S.C. 265, which would allow you to prohibit entry of certain people
The
across
answer is
the border?
yes.
And when will that happen?
Very soon, probably today. Yes.
Question for you and then a question for Dr. Burks.
Yeah.
On the border, firstly, are there plans to fully shut the Mexican border? And what do you define as essential travel when it comes to the U.S.-Canadian border?
Well, I think essential is medical. We have military working together. We have industry working together. And again, it's not affecting trade. So things like that. But just leisurely, let's go to a restaurant and have dinner, which a lot of people do. They come both ways. They go in both directions. That kind of thing we have ended on a temporary basis. Yeah, please, go ahead. Not close it. No, we're not going to close it. But we are invoking a certain provision that will allow us great latitude as to what we do.
May I ask
Please.
questions if I could?
Yeah, go ahead. You know what? Go ahead. Sure.
The Wall Street Journal. So I just wanted to clarify something, because just a week ago, you all were standing here telling us that unless you had sustained contact with somebody who was symptomatic for COVID-19, you really didn't need to worry. You told the president, the vice president, that if they shook hands with somebody who had this, if they took a photograph with somebody who had this, they didn't really need to worry. And yet, several days later, we're in a situation where people are being told, don't leave your houses. There are curfews saying you cannot walk alone at night after a certain time. Can you walk us through what seems like a very dramatic swing, a very dramatic disconnect from what we were hearing before to what we're hearing now?
So two things. We look at data all the time, and I know you're looking at the China and South Korea data. And when you look at China and South Korea data and you look what China and South Korea did, you can see that their curves are not only blunted outside of Wuhan, so the Chinese areas outside of Wuhan, blunted curve, and South Korea, blunted curve. If you look at their curve today, they're already on the far end of their epidemic curve. Of course, none of those countries are fully back to work, and so that's what we worry about too. Secondly, there was a series of scientific articles published, and I know you've seen them too, about surface contamination. I think none of us really understood the level of surface piece. So we're still working out how much is it by human-human transmission and how much is it by surface. And this is why those fundamental guidelines were put out that says don't expose yourself to surfaces outside the home. Basically what those guidelines are is don't expose yourself to excess number of persons who could be asymptomatic and infected, and then the person-to-person contact, and don't expose yourself to surfaces that could have had the virus on it, for which on hard surfaces, I know we had the cardboard issue about shipping, hard surfaces, not shown in fabric as much or in cardboard, but hard surface transmission. These are issues that we haven't had to deal with before with the level of respiratory infections, and that's why we have this concern, and that's why the President put out the guidelines. And so it's to cover both of those pieces. That's all new science, all new models. I think many of you have the Imperial study available and looked at the impact of those. That's the first time those have been modeled as a comprehensive approach to mitigating an epidemic.
And Dr. Burks, yesterday...
Mr. President, what about money?
Go ahead.
Mr. President, the Wall Street Journal is reporting that the administration has looked at an executive order that would expand the use of investigational drugs against the virus, but that FDA scientists are warning that this could put patients at risk.
I haven't
Is this
seen the
something you're
article.
looking at?
No, I haven't seen the article. We are making a lot of progress therapeutically, I will say that, but I have not seen that article, no. Go ahead.
Mr. President, we've shut down non-essential travel to Canada. Are you considering shutting down all travel to brunt the spread of the virus? And we've heard from industries like the airlines who are seeking relief. What other industries or how exactly is your administration going to determine which industries and businesses get
Well, there are
help?
certain industries that people know. I mean, the airlines would be number one if you look at what's going on. They go from having the best year they've ever had to having no passengers because of what we've had to do in order to win this war. It's a war. And so, basically, what many of the industries are. What we want to do is we want to make sure they all stay together so that after the war is won, we can immediately go right back up to where we were and even beyond. I think we're going to go beyond where we were. And a lot of people are saying that, by the way. We're poised to do that. But we have to win the war first. Yeah, please, go ahead.
President, thank you. To follow up on that, Treasury proposed $150 billion today for those industries, but their proposal doesn't detail which industries would get that money and how much. So aside from the airlines, which you just mentioned, what about the cruise industry, the hotels? Yeah. How much of that money do you see them each
We're
getting?
talking about all of it. Haven't detailed it yet. We have detailed it to senators and to members of the House. We have been talking about it, and we're coming up with numbers. Haven't gotten there yet. But certainly hotel industry, the cruise ship industry, the airlines, those are all prime candidates, absolutely.
On the northern border, sir, when you say
Which border?
the northern border,
Yeah.
when you say temporary, which is what you said in your tweet, does that mean 30 days?
I would say 30 days, and hopefully at the end of 30 days, we'll be in great shape. Jeff, please.
Mr. President, I was struck by what Dr. Burke said about millennials and others perhaps not taking some of these warnings as seriously as you would like. Some of those people also seem to be your supporters and conservatives who may be quoting some of what you said at the beginning of this, comparing it to the flu. What is your message to them to really follow what you've been saying so far, and are you concerned that they're still listening maybe to some of your earlier comments rather than your more recent ones?
Well, I think my earlier comments are to be calm. I mean, I do want people to be calm because we're going to win this and we're going to win it. It's just a question of time. And I wanted to go quickly. So based on the fact that I wanted to go quickly, I hope they just listen to what we've been saying over the last period of time. We don't want them gathering, and I see they do gather, including on beaches and including in restaurants, young people. They don't realize they're feeling invincible. I don't know if you felt invincible when you were very young, but they were feeling totally invincible or are feeling that way, but they don't realize that they can be carrying lots of bad things home to grandmother and grandfather and even their parents. So we want them to heed the advice. We mean the advice, and I think it's getting through. I do believe it's getting through, Jim.
If they're watching,
Please.
what do you say to them if they're watching? Sorry.
If they're what?
I think there are a lot of them watching, a lot of these people at home, these young people.
Well, I think I just said it.
I was going to say, what do you
Heed
say to
the
them?
advice. Heed the advice. I just said, yeah. Thank you. Thank you, Peter.
Mr. President, how long do you think
Thank
this
you,
is going to
Mr.
wrap?
President.
Mr. President, how long do you think it's going to
We'll
last?
get you next, okay? Say it.
Thank you, Mr. President. In talking about China, you've been very clear about who you think is to blame or where the origin to blame for this virus is.
Not
Senator-
think. No. I don't think. I know where it came from. I don't know if you'd say China's to blame. Certainly we didn't get an early run on it. It would have been helpful if we knew about it earlier. But it comes from China. And it's not a question about that. Nobody's questioning that.
Senator Cotton is saying that they should be punished, in so many words, for inflicting this on the American people. Do you feel that way about
Well,
it?
I have a lot of respect for Tom Cotton, and I know exactly what he's been saying. And there are those people that say that, so we'll see what happens. Thank you. Go ahead, it's your turn. Go ahead. Please. He's been waiting a long time, please. You've had your hand up so nicely for a long time. It's your time.
Thank you, sir. We've seen the Chinese government kick out reporters from the Wall Street Journal, the New York Times, the Washington Post. What is your message to the Chinese when it comes to transparency at a moment when you still have reporters asking you questions here at the White House?
Yeah, I'm not happy to see it. I don't, I have my own disputes with all three of those media groups. I think you know that very well. But I don't like seeing that at all. I'm not happy about that at all. Yes, please.
You didn't correct the language, so I wonder if you agree with it. Do you believe that China is inflicting this upon our country?
No, I don't believe they're inflicting. I think they could have given us a lot earlier notice. Absolutely. Please. Go ahead, please. Go ahead.
Yeah, Mr. President, your
credibility ratings are very low. There was a recent NPR poll.
Who are you asking that question?
I'm asking...
Because I see that they're very high. You know, if you look, I'm 95% of the Republican Party. We just had a poll that was done by a very reputable group where I'm beating Sleepy Joe Biden by a lot in Florida, in the state of Florida, and in other states. You know, so I don't really know who you're talking about. Jennifer, go ahead, please.
Two questions, if you're willing, sir. Would you give us an update on your conversation with the airline executives?
Yeah.
Did you explain to them what's coming? What was their
I
reaction?
did, and they explained to me where they're coming from. I mean, they went from, as I said, full planes, packed, the best year they've ever had by far, to boom, one day empty because of what we have to do to get rid of, to win this war. Or we would have a level of death like people haven't seen before. So they've been fantastic. I mean, they've been great. But, you know, they went from being extremely happy to being people that are running companies that are going to need some help. And we'll help them, Jennifer.
On SBA loans, would you be willing to give us an update on how that's going? We've been getting some reports that counties have been having difficulty getting...
Well, it's going. I mean, there's a lot of influx to those loans, as you can imagine. A lot of people are looking at it, but we're going to be increasing funding a lot. They're very well prepared to do what they have to do, and the SBA is doing a fantastic job. She is doing a really good job, the administrator. John?
Mr. President, a couple of questions for Dr. Burks,
yeah.
if I could. Dr. Burks, French researchers have had some luck with hydroxychloroquine in shortening the duration of disease. Is that something that might be in the arsenal of therapeutics here in the United States?
I think we're exploring every one of those issues. The president asked for a critical briefing on that today. He opened with that. It is more than that single drug. There are other drugs that individuals are looking at. Just to go back to what we've talked about many times, there is things that look really good in cell culture against the virus that may look good in small animals and then don't have an impact in humans. And so those are the pieces that we're looking at very carefully. Of course, there's always anecdotal reports, and we're trying to figure out how many anecdotal reports equal real scientific breakthroughs.
And second question, are you confident of the seasonality of coronavirus?
All we can do is look at the past to inform the future. We know what SARS looked like. We also know, and I just want to put this out, I know you can get it online, look at the curve in China and look at the curve in South Korea. Those curves were accomplished in still the winter season. And so we're trying to understand what those relationships are. We're very interested in the curves in Italy because of their different approach, and we're following every single country's curves. And so all we can do is look at prior coronavirus and prior respiratory infection RNA viruses. These are RNA viruses. When you look at flu in the northern hemisphere, when you look at parainfluenza and some of the other cold viruses, and if you look at SARS, that's the way the peak normally occurs. But that is a November to April. We all started later. And so you're asking me to predict based on a later start, and that's what we're trying to really look at China and South Korea to really inform that.
All right, Caitlin, go ahead.
A question for Secretary Wilkie, if you don't mind, or you could answer if you'd like. How many veterans of those that need to be tested have been tested?
Those that have needed to be tested, we believe we've caught most of them. Right now, we have 44 veterans who have tested positive. Sadly, one has passed in Portland. We are working with state labs and private companies to make sure that testing is available. Because the president had us out aggressively early, we have been in a better place than most healthcare systems in the country. I cannot predict, as Dr. Burke said, when the next surge will be, if it will be, but one of the things that we do at VA is that we prepare for national emergencies, be they national disasters or epidemics. We started preparing for this. We started stockpiling equipment. Our equipment is stable, and I think that's in large part because of the instructions the president gave me.
But do you have a number of how many have been tested out of the number that
We've tested several hundred. I can't give you the
the other day.
Yeah, we've tested several hundred. Yes, we've tested several hundred. I don't know exactly. I do know that 44 veterans have the virus. Most of those are quarantined at home.
Go ahead in the back.
Thank you, Mr. President. The question for Dr. Burks, quickly. I'm trying to understand what it's about the mortality rate. Yesterday, we underlined the fact that we had reached 100 deaths. And this morning, we wake up and we're at 110. Within 12 hours, we climbed by 10%. Is it something we have to expect from now on, a 10% increase every 12 hours?
So very early on in each one of these cases, if you look at all of the countries to date, the mortality is higher at the beginning because you're diagnosing the sickest, the ones who came in quite ill. And I just want to remind the American public that still the risk for serious illness in the majority of Americans are low. But that doesn't mean that you can't transmit it to one of those higher risk groups. And that's why we're asking for all Americans to take responsibility. You're seeing mortality or deaths today from infections that occurred 2 to 3 weeks ago in general. The other thing that you're seeing is the dramatic and very difficult impact of this virus in nursing homes. And that's why very early on, the President and Vice President had us come out and CMS put those very strict rules in place. And everybody thought we were being too strict and keeping loved ones away from their family in nursing homes. If we're going to solve this with a lower death rate, we have to protect the elderly because of their percent is much higher in mortality than any other age group.
Okay. Go ahead, please.
Mr. President, there's reporting that the federal government has a plan that shows that this coronavirus outbreak might last as long as 18 months. Are you seeing those numbers? Could it
No,
just
we're not
actually
seeing
last?
that at all.
And then my second question is, there are at least one White House official who used the term Kung Flu, referring to the fact that this virus started in China. Is that acceptable? Is it wrong? Are you worried that having this virus be talked about as a Chinese virus, that might
I wonder who said that.
Focus,
You know who said that?
I'm not sure the person's name, but would you condemn the fact
Say
that
the term
Kung
again.
Flu, a person at the White House used the term
Just the term.
Kung Flu. My question is, do
Kung
you think
flu.
that's wrong, Kung Flu? And do you think using the term Chinese virus, that puts Asian Americans at risk, that people might target that?
No, not at all. I think they probably would agree with it 100%. It comes from China. There's nothing not to agree. Okay, how about last question? Please, go ahead.
Switching gears very quickly to
Say it.
Switching gears to a larger question here. We've seen that before the pandemic, there were a lot of Americans that were already alienated. We saw deaths of despair increasing through suicide and other things. Now, as these individuals, a lot of times in rural parts of the country, are self-isolating, what is your message to those individuals, and what do you hope that individuals, communities, and churches will do to reach out to
My
them?
message is to all Americans, but to those Americans who are going through a lot, we love them, we're with them, and we will not let them down. Thank you all very much.
Mr. Vice President, do you agree with the term Chinese virus?
Well, thank you very much. We have the tourism industry executives, the biggest anywhere in the world. These are the great ones, and they're going to say a couple of little words pretty soon. I think we'll talk about their company quickly and the number of employees and what's happened since the Chinese virus came about, and they'll be discussing that. So we're joined this afternoon by the true leaders of our nation's travel, hospitality, and tourism industries, and I want to thank you all for being here. I've known many of you for a long time, great people. I want to thank Vice President Pence for his tremendous leadership on the task force. He's done a great job, and thanks also to Secretary Mnuchin over the Hill. They've been working, and Wilbur Ross, and everybody, basically. They're all working. We're all working very hard. We're profoundly grateful to all of the companies and organizations here today representing tens of thousands of American workers and really representing something so important. It's a place to stay when they come to our country. Such a big business, one of the biggest businesses. And thank you for adopting additional protocols to keep Americans healthy, including enhanced cleaning processes throughout your hotels and buildings. We know that your industry is among the hardest hit by the economic impact of the virus. Our goal is to beat the virus, and we will. We call it the hidden virus, the hidden enemy, with aggressive action now so that we can rebound stronger than ever before. That's what we're doing. And everyone's cooperating. We're really getting tremendous spirit. Republicans are getting along with Democrats, and a lot of good things are happening. Yesterday, we issued new guidelines for how all Americans can minimize their risk of exposure and stop the transmission of the virus. My administration has taken decisive action to support American workers and businesses. We love our workers. We love those workers. They're incredible. And we're going to come out stronger than ever before, and it's not going to be so long. The IRS will defer tax payments for affected individuals and businesses. Today, the Senate is taking up legislation to provide for free testing, and that'll happen. Paid sick and family medical leave and nutritional assistance for the vulnerable. We're announcing, and we will be announcing again later on, that we're working with Congress to provide rapid relief for affected workers and industries, and this will allow us to emerge from the strongest economy on earth, because we had literally the strongest economy on earth, and now this is in, as of last count, over 124 countries, I understand. 124 countries, unbelievable. But we'll emerge, I really believe we'll emerge stronger because we'll be doing things differently than this country's done them in the past for many, many decades. And we're deeply committed to ensuring that small businesses have the support they require. The Small Business Administration announced disaster loans which provide impacted businesses with up to $2 million, and we've asked Congress to increase the SBA lending authority. We're going to be going up to $50 billion, and actually much more than that for small businesses, so they'll be helped. In your cases, they're very big businesses, but it's a lot of employees, and so we appreciate it very much. We appreciate you being here, and maybe in front of the media you could say a couple of words about your companies and the number of people you employ. And I pretty much know every one of you in that respect. It's a lot of people, and they're great companies. Please.
Hi, I'm Chris Nassetta. I am CEO of Hilton, and we have 6,000 hotels around the world, about 4,500 hotels in the great United States of America. We employ globally about 450,000 people, about 260,000 people here in America. Mr. President, on behalf of everybody, I'm sure you'll hear this from us, we appreciate you having us here. We appreciate all that you're doing today to keep all of us safe and secure first, and working on trying to secure a good future for the economy, as you point out, that was quite strong, but obviously being impacted by this. Vice President Pence, to you and all others that are working on this day and night, we appreciate it. As the President pointed out, we're one of the biggest industries in the country. We're one of the biggest employers in the country. And our industry, as you will hear from others, has been impacted in a devastating way. I personally lived through many crises, starting with the S&L, the 9/11 crisis, the Great Recession. I've been doing this for 35 years. Never seen anything like it. And so, we're hoping to have a constructive dialogue about, how we protect the small businesses that make up the bulk of this industry. and how we protect the people on the front lines of this industry. That number, 5 million people that at this point, given what's going on in our industry, are in harm's way. So.
And tell me, so you're in many countries, and how are you doing in other countries? Some are in very, very bad shape.
I would say I was looking at our numbers for last night. It is strikingly similar everywhere in the world. If you look at around the world, I would say just a few days or maybe a week, we will probably be running 10 to 15% occupancy in the world.
And that's pretty much all over the world.
That's everywhere in the world. It's a little bit better here, but catching up. If you look at the major cities around the United States, they're running in the single digits, which means for the first time in 100 years, Hilton has been around 100 years, we've never closed a hotel that wasn't going to be demolished for rebuilding. The bulk of our hotels in the major cities are closing as we speak.
Well, we'll get it open soon, and we're doing a yeoman's effort. I think we're going to be very successful. You'll be back in business soon, but we have to keep your employees going.
We do.
The business is going.
That's our first priority.
And we will be able to do that, Chris. Thank you very much. But all over the world, it's a disaster.
All over the world, it's a disaster. There's not one part of the world that's not being severely impacted.
Yep. Thank you very much. Please.
Mr. President, Mr. Vice President, Secretary Ross, thank you for taking the time to see us, and thank you for everything that you're doing.
Thank you.
We very much appreciate it. I'm the President and CEO for Best Western and also World Hotels. We have about 5,000 hotels around the world. Half the hotels are in the United States. We employ tens of thousands of employees in our company. As Chris has really alluded to, this is a very difficult time and very challenging times for us. Just today, I had a call with one of our franchisees. He was lamenting that although he owns about 10 different hotels and different brands, and some with us and some with other brands, he was lamenting having to lay off hundreds of people in his company. Some of them have been with him for 20, 30 years, and he was really concerned about their livelihood and the safety net. And the other thing that he mentioned was if the government can help with liquidity and access to capital, that would be of great assistance. And he specifically mentioned that his loans were swap loans, and therefore there are severe penalties to refinance. And so if there's any way to alleviate that burden, that would be most grateful.
Yeah, we're dealing with the banks too, and the banks have been very accommodating. They will be. I think they will be. Thank you, David. Appreciate it. Please.
Thank you, Mr. President. Arnie Sorensen, CEO of Marriott. Thanks for giving us your time this afternoon, and appreciate the leadership of all of you as we go through this crisis. I don't need to repeat much of what's been said. We think we have about 750,000 people that wear our name badge around the world every day. Probably about 2/3 of those in the United States.
How many hotel rooms now?
1.4 million, just shy of 1.4 million hotel rooms. And as you know, the business is made up of hotels we run. Often hotels are owned by other investors, but we will operate them. And then also by franchise operators. And they are typically owner-operators. They might range from a Fairfield Inn in a suburban or rural market all the way up to a Ritz-Carlton or a St. Regis someplace. And you asked about the globe. In January, of course, this all starts in China. Business falls by 90%.
And this all started in China?
All started in China.
That's where you first saw the problem, and it's where you first got hit?
Absolutely. Third week in January, and within a week, business is down about 90%. And you've been living this just the way we have. About 3 weeks ago, we have that horrible weekend where it shows up in Korea and in Italy. They are sort of a clarion call, if you will, that it has left China and it is moving to the rest of the world. And while we didn't know exactly how it would show up in the United States, it was fairly clear that it was now a broader spread. And from that,
is China doing better now?
China, there's starting to be some green shoots. So Macau, for example, we think we bottomed at about 2% occupancy. We think
2%?
2%.
In Macau?
Yeah. And we think we might be approaching 30 as of last night. Now, that's probably one of the stronger markets in China.
It's going back.
And so they're trying to get things going again, but we're still in the rest of the world, including the United States. I get dailies, of course, of new reservations and cancellations. In every other market, the numbers are continuing to go down. So I don't think we've bottomed anywhere else yet. In the U.S., in the last couple of days anyway, when you look at decline in reservations and in cancellations, the total is negative. So we're losing business every day,
No, we're in
not
the
really getting
process.
anything new.
We haven't hit that top yet, we're in the process.
Yeah, I think that's right. And of course, we'll have some time with you today, but employees first, and I think liquidity
Right.
second is the two things that are on our list.
Thank you very much. Thank you.
Thank you, Mr. President. Ellie Malone with Intercontinental Hotels Group, Chief Executive of the Americas. Thank you, Mr. Vice President. We have nearly 6,000 hotels around the world, over 3,800 hotels in the United States, over 530,000 rooms. 80% of those are owned by small business people across 50 states, across every county, across every community. So we're experiencing the same impacts similar to what the industry, the HLA, and our colleagues here have been talking about. I want to turn attention to those small business owners in 50 states across the communities, because they're the bedrock of those communities. And as they're getting impacted, it's not just their employees that begin to see an impact in job losses, but it's entire ecosystem of their suppliers, their vendors. And so I think I'm very pleased that we can work together with you and the administration to find a solution to preserve that network of entrepreneurs across the country.
Yep, we will.
Thank you, Mr. President.
Thank you, Mr. President. Mr. Vice President, Patrick Pacia, CEO of Choice Hotels International. We have 6,000 hotels in the U.S. That's 1 out of every 10 hotels flies our flag. As others have talked about, we're in secondary and tertiary markets. We may be the only hotel in a small town. Those owners have two key concerns. One, what do they do with their employees when they've got zero occupancy? And two, how do they pay their mortgage? So it is this question of employee retention and liquidity so they can get through this period. 90% of our hotels are SBA eligible, so we're very familiar with the SBA loan program and the disaster relief. There's some red tape there that we have some suggestions that we think the SBA
give us
could-
those suggestions.
You want them right now?
Yeah,
There,
go ahead.
I'll give them to you right now. The first is the disaster relief cap. It's only $2 million, and if you've taken out the full $5 million, you can't get access to the additional $2 million. So we need the cap raised.
To what?
We need it to at least raise to 10 million on a per individual basis. Secondly is the personal liquidity test, which just got put in place. That could be rolled back. And the final one is figuring out the affiliation. So an individual may own a partnership in multiple hotels.
Right.
So that again restricts the amount of capital available to them. So we'd really like the opportunity to speak to the SBA about lifting some of those requirements to really help inject
So
more
it's
liquidity.
individual properties instead of accumulated properties.
Absolutely.
Okay, I got it. Thank you very much. Thank you.
Thank you. Mark Hoplamazian, CEO of Hyatt Hotels. We have 950 hotels around the world, and there's 600 in the United States, over 70,000 employees. And I'm not going to repeat a lot of the things that were said. We've been tracking, we have a large base of group business in the United States, big meetings and conventions, and we've been tracking major cancellations. We now have tracked in the U.S. alone canceled events, and I'm not talking about major sports leagues that have shut down, or universities and those kinds of things, but actual convenings, conventions, big meetings.
You have some of the sports leagues, right?
As customers.
You have quite a few, yeah. I would think so.
But when we look at just the other meetings that have been canceled, they involve attendees of over 1.5 million people. So when you think about the ecosystem impact, it's major convention markets where those attendees are not showing up. So they're not traveling on airplanes, but they're not staying in our hotels. They're also not going out to restaurants, and so the collective impact is quite significant. I think the key issue that I would leave you with is that the urgency is very high, because day by day, the occupancy rates have dropped precipitously. So now we are seeing occupancies below 10% in the single digits for the vast majority of our hotels, whereas a week ago they were 20, 30 points higher than that. It's happened very rapidly.
When this ends, do you see a quick buildup?
I think that all depends on how confident people are to get back on planes and start traveling again. So I think that's really the key issue. We've got to also position ourselves to get people back into their jobs. Either retain them or rehire them. One of those two things are critical, because we all are proud of the people that we employ and we want to retain them. So whether we can retain them or have some assistance in getting them rehired early so that we can spool back up.
Hopefully you can retain them.
Hopefully
that's what we're shooting for. You want to retain them.
I think the issue with that, sorry to interrupt, Mark, Mr. President, is that when our owners are running 8-9%, so they said we're shutting hotels, so all of those employees are being furloughed or laid off right now. day by day.
It's happening.
You know, Jim Murren's here somewhere, 80,000 people this week. We're tens of thousands because our owners can't pay it. And so
that's the key issue that I was really making is the timing. It's happening instantaneously.
one of the things we want to talk about is trying to create a fund for those people in order to stop that from happening.
What kind of a fund would that be?
I think that would have to, in lieu of sort of the unemployment insurance, it would be.
In terms of dollars?
I think the fund for that, probably our quarterly payroll for the industry is $45 billion in total. So that you can sort of scale it from there.
Yeah. I got it.
Mr. President, Mr. Vice President, thank you for your time. The CEO of Wyndham Destinations, and we're in the vacation ownership and exchange business, the world's largest company in that space. We employ 23,000 associates and take care of over 5 million households on vacation every year. Largely in the industry, it's about an $80 billion impact to the overall economy, and we employ directly 250,000 and another 250,000 through other small businesses that work well with our industry. To your point about a quick recovery, we purely serve a leisure customer, which means just like after 9/11, just after the 08-09, our customers will be back really quick as soon as we're on the other side. And we really believe our industry will recover quickly and be an accelerant back to the economy once we get to the other side.
I think so too. Thank you very much.
Thank you.
Thank you, Mr. President, Mr. Vice President. It's Jim Murren, the Chairman and CEO of MGM Resorts. It's good to see you all again, Mr. Secretary.
Where did you get your chair? What happened?
Well, we're in the spatial recognition world, but I just wanted to say, on behalf of MGM, we have made the decision around the country to close our resorts, and tomorrow night we will close all the resorts in Las Vegas. That's 70,000 people we are now putting on a furlough. I want to retain those employees. I want to bring them back as soon as possible. Las Vegas, as you know, will come back rapidly once you give us the green light, but it's very important that we keep these people on our payrolls as soon as possible. I also represent the 2 million jobs of the gaming industry in the United States. And as you know, many of those casinos are in cities that rely upon them for their tax revenue. So I appreciate your efforts, and I stand by to help you in any way I can.
Okay, we'll get it done, Jim.
Thank you.
We'll get it done.
I'm Richard Bates. I'm with Walt Disney Company, and today I'm here for the theme park and motel business. So thank you, Mr. President, Mr. Vice President, Mr. Secretary. We have about 220,000 employees. We think our company is great because of our employees, so employee retention is the single most important issue for me. Second would be liquidity. So I frankly support some kind of employer payroll tax holiday. I don't know if you're still...
Is that what you like the best of the various scenarios?
I like them all, but that one I like a lot.
Most direct. Not as quick, but most direct.
I think so.
Thank you.
Especially, Mr. President, because a lot of us have, like Disney voluntarily closed their parks, so they have people out of work today. And as MGM, we have voluntarily closed these resorts. And if we can get some relief on that, we will absolutely want to keep these people on board.
Let me ask you, the parks outside of the United States closed? You closed all of your parks, everything closed. That's a real worldwide problem, isn't it?
Absolutely.
That's incredible.
And I'm sorry, one last point, Mr. President, on Macau, because Arnie Sorensen was talking about. Of course, we own 2 resorts there. The government shut those casinos down, as you know, for 2 weeks. We're starting to slowly see a recovery there, but it is absolutely single-digit occupancy right now. So we're not seeing any better results there currently.
You guys okay? Yes, please.
Chip Rogers, President and CEO of the American Hotel and Lodging Association. I'll be quick. Industry-wide, last year, occupancy was 67%. That helped support 8.3 million jobs. Right now, as these gentlemen have indicated, we're probably under 20% nationwide and headed south. If by the end of the year we get up to 35% and nothing else happens, that'll be about 4 million jobs lost. That's if we can get back up to 35%.
But they'll come back as we age a little bit, right?
Yes, quicker the better.
Yeah, I think so. May come back fast. Thank you very much. Okay, thank you all very much. Thank you, please.
Come on, guys, let's go.
Send checks to everybody. How much money are you talking?
That's all being figured now, and we're also helping industries like Boeing. We have to help Boeing. We have to help the airline industry. It wasn't their fault. This wasn't their fault. And we will do that. We'll be doing that. So we're adding it up. It'll be fine. It'll come back very quickly once we're finished with our war with the virus.
Mr. President, since I got the payroll tax holiday, nothing as big as 12.4% has ever been tried. They did 2% in 2010.
They've done it in smaller amounts, yeah.
They've done it in smaller
But
amounts.
we have a lot of
Can the
other...
country afford something that big?
Right. Well, they can definitely afford it. The question is, do we want to go through payroll, or do we want to do... there are 4 other ways of doing it. And that's what we're determining along with the Senate right now. Senate and House. We're all working on this together, John. Thank you all very much.
Press, we're done, let's go.
Tens of thousands of employees of all of these companies who've been furloughed. They live paycheck to paycheck in many cases. What is your message to them, Mr. President?
Well, the message is that this was something that happened. It's nobody's fault. It happened, and we're going to take care of it. We'll be bigger, stronger, better than ever before, and it won't take that long. Thank you very much. Thank you very much, everyone. Thank you. Progress being made. And I appreciate you all joining us. Last night, the FDA announced groundbreaking new policies to further increase testing, very substantially so. All states can now authorize tests developed and used within their borders in addition to the FDA. So the states are very much involved. They have been involved from the beginning, but we're stepping it up as much as we can, and the testing procedures are going well. And within a short period of time, all of the private labs will kick in. This has never been done before, and it's going to be something I think it's going to be incredible if it's done properly. And these are great companies. These are among the greatest companies in the world, actually. So the state's going to be dealing through themselves and with local government, local physicians, local everybody. They're also dealing with us, but we have a tremendous testing capacity. Today, we're also announcing a dramatic expansion of our Medicare telehealth services. Medicare patients can now visit any doctor by phone or video conference at no additional cost, including with commonly used services like FaceTime and Skype. A historic breakthrough. This has not been done before either. In addition, states have the authority to cover telehealth services for their medical patients. And by doing this, the patient is not seeing the doctor per se, but they're seeing the doctor, so there's no getting close. During this time, we will not enforce applicable HIPAA penalties so that doctors can greatly expand care for their patients using telehealth, so the penalties won't be enforced. We encourage everyone to maximize use of telehealth to limit exposure to the virus. It's been a very successful method of communication, but never used on a scale like we're going to use at telehealth. And you'll be able to also better maintain hospital capacity by doing this. Earlier this morning, I spoke with executives from America's fast food industry, Wendy's, McDonald's, all of the big ones, Burger King, and they were great. We're talking about the pickups in light of yesterday's guidance you heard. To avoid eating or drinking at bars, restaurants, or public food courts, we discussed the important role that the drive-through pickup and delivery service can play in the weeks ahead. So that's happening, and they have been fantastic. They have been absolutely fantastic, and they've been doing it already, but they're keeping it open, and smaller staffs, very capable people and very capable companies, and they're doing it, pickups. Our guidance yesterday urges Americans to take action for 15 days to help stem the outbreak. So it's a 15-day period. I guess now would say it's a 14-day period. It's 15 days from yesterday, and we're asking everyone to work at home if possible, postpone unnecessary travel, and limit social gatherings to no more than 10 people. By making shared sacrifices and temporary changes, we can protect the health of our people, and we can protect our economy, because I think our economy will come back very rapidly. So it's 15 days from yesterday. We'll see what happens after that. If we do this right, our country and the world, frankly, but our country can be rolling again pretty quickly, We have to fight that invisible enemy that, I guess, unknown, but we're getting to know it a lot better. Today, the Senate has taken up coronavirus legislation that includes free testing for those who need it, as well as paid sick leave and family medical leave for workers affected by the virus. We're also committed to getting small businesses the support that they need. In fact, one of the things we talked about with the fast food operations, we spoke to the chairman and CEOs of all of the companies, but one of the things we discussed is exactly that, getting small businesses support and flexibility that they need for themselves and for their workers, and that's being worked on right now. At my direction, Secretary Mnuchin is meeting today with senators on additional stimulus packages. I can tell you he was meeting with them late until the night last night, and for a big part of the day yesterday, and tremendous things are happening. There's great spirit, tremendous spirit, and I can say that for Republicans and Democrats. I can say that with respect to Governor Cuomo, we had a great talk this morning. We're both doing a really good job, and we're coordinating it. And we agree, different states need different things, and we agree on that 100%. But we had a very good talk, and I think we're right down the same track, and it's going to be very successful. New York has a pretty big problem. I guess would be the #1 hot spot. That's no fault of anybody's. It's just the way it is. But we're working very closely together. We're also getting FEMA very much involved. They've been involved, but now we're getting them to a different level. And we'll have everything ready. We're dealing with the Army Corps of Engineers should that be necessary. We have them working in some cases, on standby in other cases. But my conversation with Andrew Cuomo was a very, very productive one and a very good one. I appreciate that. We're giving relief to affected industries and small businesses, and we're ensuring that we emerge from this challenge with the prosperous and growing economy, because that's what's going to happen. It's going to pop. One day we'll be standing possibly up here, we'll say, well, we won. And we're going to say that. Sure as you're sitting there, we're going to say that. And we're going to win. And I think we're going to win faster than people think, I hope. Later today, I'll meet with the leaders from the tourism industry, as well as industrial supply retailers and wholesalers, to discuss their critical roles. As you know, I met with the department store people, all of the retailers, the big ones, including Walmart and others. And it was a great meeting. They're stocking up their stores like they've never stocked them before. We're trying to get people to actually buy less, if that's possible, buy less. Don't take everything, just buy what you need for a while. They're going to stay open all hours of the day, and they've been fantastic. We're taking aggressive action now as one nation and one family so that America can rebound stronger, frankly, stronger than ever before. And we recognize that while many American workers can work from home, many others cannot. Many of our healthcare providers, first responders, and men and women in the food service and manufacturing are showing that they're showing up and standing up to provide us with the goods and services we need. So we want people to stay home where they can, but in many cases, when you talk about food service and manufacturing, certain items in particular, they're going in and they're practicing all of the safety rules and regulations that we talk about. So with that, I'd like to just introduce our Trade Vice President, Mike Pence. He'll say a few words, and then I'll make some other introductions. Thank you very much.
Thank you, Mr. President, and good morning. It should be very clear to the American people that President Trump has initiated not only a whole-of-government approach, but a whole-of-America approach. And the President's interaction even today and through the course of this day with leaders in industry around the country reflects that we're not only bringing the full weight of the federal government to bear, but the full weight of the American economy. And I know I speak on behalf of the President when I say how inspired we are at the way the American people have stepped up and the way that American businesses, large and small, have stepped up. It's truly been inspiring. Our task force met this morning. We continue to focus on President Trump's priorities of testing, prevention, and supplies. And in that category, I'm pleased to report that while testing is available in all 50 states, as the President just indicated, through the swift action of the FDA at the encouragement of governors around the country, now state health authorities can authorize labs in their state and expand existing testing capabilities. But also in connection with the FDA's action, which you'll hear more about in a moment, we now have continued to expand the public and private partnership that the President forged with vast commercial laboratories around the country, increasing access to the high-volume, high-throughput coronavirus testing that is greatly expanding access even as we speak. Also, our task force received a report this morning on the progress that the U.S. Public Health Service and FEMA are making, working closely with state governments and also partners in the private sector like CVS, Target, Walgreens, and Walmart to expand remote testing sites around the country, and we'll have a full report later this week as those come online. It's important the American people understand that testing is happening all over the country, but all of our health experts wanted me to tell the American people, you don't need the results of testing to know what you should do. And President Trump's 15-day coronavirus guidelines are advice for every American in every community. They're the result of the best guidance of CDC and our health experts. And as the President said, we continue to urge every American over the next 15 days to put into practice the principles in the President's coronavirus guidelines. By every American practicing these principles, we believe that we can slow the spread of the coronavirus. In fact, our experts have told our task force that if every American acts on the President's coronavirus guidelines, we could see a substantial reduction in the spread of the coronavirus. But as the President said, it will take all of us to do it. And so if you feel sick, stay home. If someone in your house tests positive, keep the entire household home. Especially if you're a person with an underlying health condition, we urge you to stay home and practice social distancing from people. No social gatherings of more than 10 people. Use drive-through, as the President discussed with leaders in the industry today, and every American, especially practicing common sense and good hygiene. For the American people as a whole, the risk of serious illness remains low, but we're asking every American to partner with us in this effort to slow the spread of the virus, and especially to be mindful of seniors or others with serious underlying health conditions for whom the threat of the coronavirus can be very significant and very real. As I said, the President has continued to push our task force to bring a whole of government, a whole of America approach, and we continue to be inspired the way our nation's governors and nation's businesses are responding. We spoke just yesterday with the leaders of every broadcast network in America that will soon be unveiling a public service campaign using CDC guidelines. And specifically, as we work on the issue of supplies, meetings yesterday with Department of Defense officials about excess supplies. The President and I will be meeting today to speak about the supply chain for hospitals. We would make one specific request, and that is we would urge construction companies to donate their inventory of N95 masks to your local hospital and forego additional orders of those industrial masks. Because of what the President asked to be included in legislation moving through the Congress today, those industrial masks that they use on construction sites are perfectly acceptable for healthcare workers to be protected from a respiratory disease. But we're asking construction companies that our President knows very well from his background, we're asking them to donate their N95 masks to their local hospitals and also forego making additional orders. At the President's direction, we will continue to do whatever it takes. We'll continue to marshal the best of the American people, the best of all the people behind me, the people behind them, our state and local officials, and we will get through this, and we will get through this together. Thank you, Mr. President.
I want to thank Chad Wolf and Homeland Security. The job they did at the airports was really incredible. They screened thousands and thousands of people. O'Hare got backed up a little bit, but they got them out. But everybody was screened and screened very carefully. They didn't want to rush it. I think it was 13 airports, and it was an incredible thing. Then they had a big surge also from the UK and Ireland, and that went very smoothly. But they did a fantastic job. They worked long hours, and they did a fantastic job. I'd like to introduce Steve Mnuchin, and then I'm going to ask Steve to leave because he's going to the Hill. He's been working very hard with the Senate and with the House on a very, very big, bold package. It's going to be big and it's going to be bold, and the level, again, of enthusiasm to get something done, I don't think I've ever seen anything quite like it. So, Steve Mnuchin, please.
Thank you, Mr. President. I'd like to announce some very significant actions that the President has approved today. The first I would say is earlier today, I sent a letter to Fed Chairman Powell approving his request to use 13.3. And what that will do is the Fed will be setting up a special purpose vehicle, which the Treasury will invest $10 billion in from one of our funds. That will enable the Fed to guarantee the purchase of A1, P1 commercial paper going forward. That is a $1 trillion market and is critical to American workers, it's critical to American business, and it's critical to American savers who have a lot of that money in money market funds. So we heard loud and clear there were liquidity issues. This is very significant and will create, I don't think we'll need to use it all, but we have the ability to have the Fed purchase up to $1 trillion of commercial paper as needed. That has already created significant stability in the market today. The second thing I would say is, we've previously talked about deferring IRS payments. The President earlier this morning authorized me to announce this program. I have previously announced we would defer $200 billion. The President suggested we increase that to $300 billion, which we will be doing. Now, let me just be clear on the specifics. We encourage those Americans who can file their taxes to continue to file their taxes on April 15th, because for many Americans, you will get tax refunds, and we don't want you to lose out on those tax refunds. We want you to make sure you get them. Many people do this electronically, which is easy for them and easy for the IRS. If you owe a payment to the IRS, you can defer up to $1 million as an individual. And the reason why we're doing $1 million is that covers lots of pass-throughs and small businesses, and $10 million to corporations, interest-free and penalty-free for 90 days. All you have to do is file your taxes. You'll automatically not get charged interest and penalties. Now, of course, any American has the right to extend their taxes. We're not taking that right, but the President has asked us to go up to $300 billion. That's also an enormous amount of liquidity in the system. The third thing is the President and I worked on a very significant economic stimulus plan. Thank you for being available last night and throughout this morning, and I will be presenting that to the Republicans in the Senate this morning, and also discussing that with the House. We look forward to having bipartisan support. We're now working with the Senate to pass this legislation very quickly, and these will be payments to small businesses. We've talked about loan guarantees to critical industries such as airlines and hotels, and we've also talked about a stimulus package to the American worker. You can think of this as something like business interruption payments for the American workers. Thank you.
Do you have any questions for the Secretary of the Treasury?
When you say a stimulus package for American workers, do you mean direct payments to Americans, or are you talking about a payroll tax holiday?
Although the President likes the idea of the payroll tax holiday, I will tell you what we've heard from many people, and the President has said we can consider this. The payroll tax holiday would get people money over the next 6 to 8 months. We're looking at sending checks to Americans immediately. And what we've heard from hardworking Americans, many companies have now shut down, whether it's bars or restaurants. Americans need cash now, and the President wants to get cash now. And I mean now, in the next 2 weeks.
How much?
I will be previewing that with the Republicans. There's some numbers out there. They may be a little bit bigger than what's in the press.
Go ahead, please. Please, wait, please.
What help are you going to give to airlines specifically?
I've had discussions with all the airline CEOs this week. The airline CEOs have had conversations with the Senate and the House. As the President said, I was up with a subset of the Republican senators last night. I've discussed that with them. I think, as you know, this is worse than 9/11. For the airline industry, this is, they are almost ground to a halt. The president wants to make sure that although we don't want people to travel unless it's critical, we want to maintain for critical travel the right to have domestic travel.
$60 billion, is that enough?
I'm not going to comment on the specifics. I will tell you we're very focused. There's a lot of workers. This is strategically important to us, and we'll be working with Congress on this.
The airline industry will be in good shape. Yeah, go ahead, please.
There's been talk about $1,000 checks to every American, increasing support among Republicans and some Democrats for that. Would you support that going to everyone, or would you support some sort of income restriction on who gets a check?
Well, I think it's clear we don't need to send people who make $1 million a year checks, okay? But that's one of the ideas we like. We're going to preview that today, and then we'll be talking about details afterwards.
Well, I think we're going to do something that gets money to them as quickly as possible. That may not be an accurate way of doing it, because obviously some people shouldn't be getting checks for $1,000. And we'll have a pretty good idea by the end of the day what we're going to be doing.
Mr. Secretary,
Yeah, John,
Can you tell, how would the mechanics of this work? I mean, we've been talking about a payroll tax holiday, some $500 billion worth was floated to me today. But so how would this idea of sending people a check work? Would that be sort of advance on what they would pay in payroll tax? How would it work?
Again, we want to make sure Americans get money in their pockets quickly. We want to make sure small business owners have access to funds. We want to make sure that hotels, airlines, we have an entire package. We'll be laying out those details later today.
Yeah, I have to say this. There are 4 different ways you can do it. That's okay. 4, you can hear me well enough, I imagine.
Sorry.
Okay. People at home, you're right. Those are very important people. Come to think of it, especially your people. Look, we have 4 or 5 ways we can do it, 4 ways in particular. I think there's a 5th possibility, but there are some very good ways of getting the money out and getting it out quickly. Payroll tax is one way, but it does come over a period of months, many months, and we want to do something much faster than that. So I think we have ways of getting money out pretty quickly and very accurately. Okay?
Can you talk about the timeline, please? How quickly do you think you can get this done?
The president has instructed me we have to do this now. So this is now.
By the end of the week?
We are going to work with the Senate, who's in session right now, actively. We will continue to have conversations with the House. I've already spoken to Speaker Pelosi once today. This is stuff that needs to be done now. The president has instructed me that this is no fault to American workers. For medical reasons, we are shutting down parts of this economy, and we're going to use all the tools we have, as I've said, and what tools we don't have, we're going back to Congress. I got to go back to
$850 billion. To those who might be concerned that's too expensive?
We don't want to talk about it, but it's a substantial number. We're going big. The expression, we could do it 2 ways. We could keep going back every day or every week. We're going big, and that's where Mitch McConnell, that's the way he wants to go. That's the way I want to go. I think we want to get it done and have a big infusion as opposed to going through little meetings every couple of days. We don't want to do it that way. We want to go big, go solid. The country is very strong. We've never been so strong, and that's what we're going to be doing. We don't want, with this invisible enemy, we don't want airlines going out of business. We don't want people losing their jobs or not having money to live when they were doing very well just 4 weeks ago. So we're going big, and that's the way it'll be, and that's the way everybody seems to like it on the Hill. Any other questions for Steve?
In addition to airlines and hotels, you had a call with restaurants today. Was any type of emergency assistance discussed on that call? A lot of restaurants have to close. Even if they are doing delivery, they're not making as much money as they would with a full house.
Well, let me make 2 comments on the restaurants, and the president understands this. This was emphasized this morning. First of all, we want to make sure that the states allow the drive-through portion of these fast foods to stay open, particularly in a time period where we're telling people don't go to restaurants. These companies feed a big part of America, and I expect they're going to feed a bigger part of America. The second thing they asked me to emphasize, I wasn't going to do it now, but as long as you asked, many of these companies have apps. You can order ahead of time. That way when you get there, it's as simple as they'll have it packed. They can give it to you with social distancing, and it'll be very fast. So we expect that they will be able to feed a large part of the population. And in regards to support, I will say a lot of these businesses are small businesses, are companies, franchisees, 500 or less, and we have a specific program we'll be unveiling that helps all businesses, small and medium-sized businesses of 500 and less.
There's also a question regarding Marriott Corporation. It announced that it is furloughing thousands of individuals because of the impacts of the coronavirus. Will your legislation help those individuals?
I hope so. That's one of the reasons why we got to act very quickly, because we understand, whether it's the airlines, hotels, for good reasons to protect the United States on medical issues, these businesses are shut down, and the president wants to make sure, as I've said, we will use all the powers we have. You saw this today, $1 trillion of potential liquidity into the market, and the powers we don't have, we're going to Congress, and I will say there's a lot of bipartisan support for these issues. So I'm going to apologize because I have to go deal with some other things, if that's okay, Mr. President.
Thanks.
Oh, yeah, I do want to comment on this, okay? We absolutely believe in keeping the markets open, okay? Americans need to know they have access to their money. After September 11th, the only reason why the markets were closed was because the technology was disrupted. I've been on the phone with the major banks, with the New York Stock Exchange. Everybody wants to keep it open. We may get to a point where we shorten the hours, if that's something they need to do, but Americans should know that we are going to do everything to make sure that they have access to their money at their banks, to the money in their 401ks, and to the money in stocks. So I want to just be very clear, we intend to keep the markets open.
And the banks are record-setting strong, so we have that, which is a much different event than what we had not so long ago. John, go ahead.
Mr. President, you mentioned the Army Corps of Engineers. I know that you've had a conversation with Governor Cuomo. He believes that New York is going to run out of hospital beds. Are you prepared to mobilize the Army Corps
we've been asked to
increase capacity?
Yes, we're starting to. We're starting the process, and it's a process. We hope it's not going to be necessary, but it could be necessary. The state is working on it very hard themselves, but we'll probably supplement what they're doing.
And given that many of the precursors for our pharmaceuticals come from China, and there have been supply disruption, that supply chain has been broken to some degree. Do you expect that we could run into a shortage of prescription drugs?
No, I don't see that at all, and I think China has every incentive to make sure that things work well. China wants to make sure that things work very well. They have every incentive to do so. John?
Mr. President, the governor of Ohio has called off the election that was supposed to happen today, the primary election. Do you agree with that decision, and what steps are you taking to ensure that elections going forward, if this pandemic continues, that elections will be able to happen, including, of course, the big one in the fall?
Well, the governor of Ohio is doing a great job. He called that off, and we'll see what happens. There's a court case, and it hasn't been fully determined yet. But if he called it off, I could understand that, because he's definitely somebody that knows what he's doing. We'll be seeing very soon. They're going by the rule of 10 as opposed to 50, and that's pretty tough. I would say probably you could violate that if you wanted to for an election. I just think an election is a very special thing. He chose a different date, I think a date sometime in June. But that would be a decision that would be made by him. He felt it was necessary. The courts somebody's challenging it, so the courts will ultimately decide.
But what are you doing to ensure that further elections, if we're still in this situation a month from now, 2 months from now,
what I'm doing, John, is very simple. We're getting rid of this virus. That's what we're doing. That's the best thing we can do. By the way, for the markets, for everything, it's very simple solution. We want to get rid of it. We want to have as few deaths as possible. This is a horrible thing. You look at what's going on with Italy. We don't want to be in a position like that, but a much larger, because we're a much larger country. We don't want to be there. And I think we've done really well. I think we've done well. I think the states have done well. We're all working together. The best thing we can do is get rid of the virus. Once that's gone, it's going to pop back like nobody's ever seen before. That's my opinion, but I think it'll pop back like nobody's ever seen before. Please.
Just to follow up on John's question, specifically how many new hospital facilities could the Army Corps of Engineers build? And also, what specific measures are you taking to try to increase the number of ventilators in the stockpile?
Right, we've ordered massive numbers of ventilators. We have, by any normal standards, we have a lot of respirators, ventilators. We have tremendous amounts of equipment, but compared to what we're talking about here, this has never been done before. And yesterday I gave the governors the right to go order directly if they want, if they feel they can do it faster than going through the federal government. Now, we've knocked out all of the bureaucracy. It's very direct, but it's still always faster to order directly. And I gave them, that was totally misinterpreted by the New York Times on purpose, unfortunately. But but it's very important. Yes, Mike?
I could amplify.
Yeah, please.
Yeah, thank you. Our President directed us to work with the Department of Defense. There's two ways that DoD can be helpful in terms of expanding medical capacity. I know the governor of New York has asked us to look at the Army Corps of Engineers, which could perhaps renovate existing buildings. But the President also has us inventorying what you all would understand as field hospitals or MASH hospitals that can be deployed very quickly. We spoke with Governor Inslee yesterday in Washington State. We have resources in that part of the country that we could move. And as governors make these requests, we will process them, bring them to the President. But there are two different lanes that DoD can provide, in addition to many medical supplies to augment our national reserves. And the President has tasked us to evaluate, make available, and to consider every request from governors for either field hospitals, expanding facilities, or the Army Corps of Engineers that could retrofit existing buildings.
The Army Corps is very prepared to do, as we say, and we're looking at where it's going. But and they do call them MASH hospitals, but the field hospitals go up very quickly. We have them. We have all of this equipment in stock, and we're looking at different sites in a few different locations. And we're not going to need them in West Virginia, where so far I guess they have none. Still none? Still none, right? West Virginia.
No.
Big Jim, the governor's, he must be doing a good job.
Or is that just reported?
That's what's reported.
No, but is that a reporting issue, or is that they have no cases?
Well, that's all that, I just see West Virginia is the only one that has no cases. So obviously that's being treated differently than in New York or California, different parts of California. I do say this, though, the Army Corps of Engineers is ready, willing, and able. We have to give them the go-ahead if we find that it's going to be necessary. We think we can have quite a few units up very rapidly. I'm going to work with Governor Cuomo. I'm going to work with a number of the governors. Governor Newsom has been very generous in his words, and I'm being generous to him too, because we're all working together very well. And I think a lot of very positive things have taken place. We're talking to California about different sites, but we can have a lot of units up fairly quickly if we think we need them. I think what I'll do is I might ask Seema to say a few words on the telehealth, and then we can get back to this, please. Seema?
Thank you, Mr. President. And as the President announced earlier, we are doing a dramatic expansion of what's known as telehealth for our 62 million Medicare beneficiaries who are amongst the most vulnerable to the coronavirus. And we're acting in accord with the appropriations bill that was signed on March 6th, as well as the President's emergency declaration last week. And this action is a part of our broader effort to ensure that government requirements, rules, and regulations don't get in the way of patient care during an emergency. And today's announcement builds on the significant progress that the President has already made over the past 3 years around telehealth services. And while we have allowed for virtual check-ins, full telehealth benefits have been restricted to those living in rural areas, established patients, and just for those brief visits. But no longer, Medicare beneficiaries across the nation, no matter where they live, will now be able to receive a wide range of services via telehealth without ever having to leave home. And these services can also be provided in a variety of settings, including nursing homes, hospital outpatient departments, and more. And thanks to the leadership at HHS, we'll also be temporarily relaxing certain HIPAA requirements so that doctors can provide telehealth with their own phones, and we'll be using enforcement discretion when it comes to collecting copays so that cost won't be a barrier. This is a part of our larger efforts around mitigation, and as we are encouraging Americans to stay home whenever possible, we don't want our Medicare policies getting in the way. And so consider the implications of this. Perhaps an elderly patient with diabetes needs a routine checkup, and this has nothing to do with the coronavirus. And so with our new telehealth benefits, this person who's not really, who's at risk for the coronavirus doesn't have to venture outside their home. They can talk to their doctor via Skype, and they don't have to risk exposure to the virus, and they can receive that care from the safety of their own home. It could be another Medicare recipient who's experiencing mild flu-like symptoms, and instead of leaving the house and sitting in a waiting room full of other vulnerable people, they can also receive advice from their doctor from their home. And this shift is very important for clinicians and providers who over the coming weeks will face considerable strain on their time and resources. And now Medicare patients who don't absolutely need to come in to an office won't have to, and this allows the healthcare system to prioritize for care for those that are that have more needs or in dire need, and preserves protective equipment as well. State Medicaid agencies can also provide telehealth services without federal approval, and so we're asking all states to make this available as well. And we've also asked private insurance companies to expand their telehealth benefits and make it clear to their providers and their members what they cover. As our nation seeks to balance the twin imperatives of getting Americans the care that they need during this outbreak and limiting the spread of the virus, the impact of this historic action simply cannot be overstated. In an emergency, those on the front line shouldn't have to worry about federal rules and red tape, hamstringing them when they need flexibility above all else. And we're doing everything in our power to make sure that that doesn't happen. I also just want to briefly mention that because of the President's emergency declaration, we do have the ability to provide a lot of Medicaid waivers, and Florida was the first state to be approved. We were able to do that in a matter of days. Thank you.
Any questions, please?
Where do senior citizens go for instructions on how to do the telehealth?
They should call their doctor's office, and their doctor's office can tell them how to do that. Also, there may be some of our Medicare members that may not have access to equipment, so we're asking family members to help with this, but also respecting the requirements around social distancing, and if any of those family members or neighbors have symptoms, they should obviously stay away.
Will you be posting numbers also?
That's correct,
That might
exactly.
be the easiest way to do it.
Yes.
If you post in ads, if you post some numbers.
And they can also call our 1-800 Medicare number, and they can also get information. Those phone lines are open.
Thank you. Thank you very much. Admiral, if you'd say a few words about where we're going, and then I'd like to ask Dr. Birx to say a couple of words, but how the system's working.
Well, thank you very much. As we talked about earlier this week, the commercial system is rapidly advancing in the testing capabilities. As of today, our public health laboratories, meaning the CDC and the public health labs, have reported out 31,878 tests, so almost 32,000 tests. The clinical laboratories, the Association of Clinical Laboratories, have reported out about 27,000 tests, and most importantly, of those 27,000 during the cumulative period of time, 8,200 of them were yesterday. This is showing the dramatic ramp as the high throughput comes in. We don't have the numbers this morning from the American Hospital Association, which means all the individual hospital laboratories. We will have that upcoming in the next day or so, and then Ambassador Birx will have this whole process fixed with the legislation that everything will roll up into a common reporting probably by the end of next week. In terms of our drive-through laboratories, again, these are blossoming all over the country by individual states. The ones that we are heavily involved in and really pushing equipment to, we expect over the next few days to begin setting up 47 of these in approximately 12 states. The material is already palletized and being shipped to the locations. Most cities have the specific locations, some do not, but it's still going to a central receiving, and we know that we'll be deploying at least 140 Commissioned Corps officers. About half of the sites have reported their requirements. About 140 officers will be going. We expect that to go up. So this is going on the way we expected. We did a trial site yesterday with a full mobile unit for drive-through with full PPE. We had a lot of kinks in the system, as you can expect. That's why we do a test before we go out into the field. Don't expect these to be 100% perfect the moment they come. They're going to be adapted to the state and the local situation, but we're very confident that these will add testing to the already very robust healthcare system and commercial system. Thank you, Mr. President.
Thank you very much. Thank you, Admiral. And this has never been done before, and it sets a great roadmap for future. Should we have something like this in the future? I hope we don't. But it's never been done before, and they've done an incredible job. And again, we're working with the states and relying on the states. We have to, because they have, it's point of sale, it's point of sight, and we're in, I think, just about every instance getting along really well with the states. If I could, Dr. Birx, if you could say a couple of words, please.
Great, thank you. Thank you, Mr. President. So I think what you've been hearing from us is to find solutions that are high quality and sustainable based on the frontline workers and governor's requests. And those come in on the governor's call. We've been immediately responsive to those. And that's the level of red tape and bureaucracy that we have removed. I think that point about sustainability and quality is very important because, as the President says, we're creating a roadmap for a different level of functionality for future pandemics. Our flu pandemic preparedness plan was a plan. Now we're seeing where we have to revise, where we have to create new avenues of research, new avenues of work to really ensure that the need of the American people can be reached. We were adamant about having a high-quality test based on our commercial vendors. Over the next few months, you will begin to see that other tests that were utilized around the world were not of the same quality, resulting in false positives and potentially false negatives. These tests were studied and studied by the FDA to really ensure that they are that level of quality, and we've given the states the permission to ensure that same level of quality. Now, I want to just say 1 minute on the testing. Testing should not be used as an assessment of your risk. We are asking every single American, no matter what your generation, from Z and up to X and millennials in between, to really ensure that you're following these guidelines. We hear every night of people who are not in work, moving that time into bars and other areas of large gatherings. If we continue with that process, we will fail in containing this virus. So every single generation has a role to play. We're asking our older generation to stay in their homes. And we're asking the younger generations to support them in social contacting through videos and other Skype-type functions, or just the simple telephone. We're asking the younger generations to stop going out in public places, to bars and restaurants, and spreading asymptomatic virus onto countertops and knobs and grocery stores and grocery carts. I heard an innovation last night and this morning again on the news. I really want to applaud the private sector who are now creating senior-only shopping times. I think that's extraordinary. I think that shows what America brings, and I think other countries will learn from us about how to really protect seniors in this type of way. I'm hoping that carries through to next year when we have our flu epidemic, where we can really have a very different profile of the amount of mortality that we have during flu that we never talk about. Anywhere from 15,000 to 45,000 individuals are lost every year. If we learn how to do this well and sustain some of those core changes, we can change the way respiratory viruses, not only for this, but the future, affect Americans.
It's a big thing. Doctor?
Yeah, so a question on the clinical data. So we've had now roughly 5,000 people test positive. We've had 90 deaths or so. When are we going to know the data of who those people are? Who has been infected, what the ages are, what the pre-existing conditions are, how serious it was, both for those who have been tested positive, but also those who have died?
Well, you are singing my sheet of music. I'm very data-oriented, so thank you for bringing up this issue of data. I really want to applaud HHS. We had a discussion about this several days ago. They've made calls into Seattle and California to really understand that, and also importantly to understand how many of their patients needed ventilators, how many of them needed oxygen support, how many of them needed and what they needed. Could we predict early someone who was going to have a more difficult course? These are all the questions we're asking and answering right now. We did get an early report back from Santa Clara and Seattle. We're digesting it. We just got it this morning. We're looking at that carefully because we think that roadmap is very important to other communities. We have not discussed this with New York yet. We do know from other countries, and that all is available online, that profile. You can see that mortality under 30 is extraordinarily low. The mortality across the board outside of Wuhan is now settling somewhere around 0.7, but that should not be reassuring because it's much higher in people with pre-existing medical conditions, even if young, and people that are older with pre-existing medical conditions. And so we still want every American focused on doing what they can do today to change the course of this pandemic.
Will you commit to making that data public so we will all know?
We're committed not only to making it public, but to have a website that everyone can see in real time.
Dr. Burks, if I could just follow up. You all are signaling a much more aggressive posture toward containment mitigation now. And many states have been very aggressive. But there is a small number of states that have not issued public guidance to their residents. Is it important for the success of the effort that 100% of the states be forward-leaning on this? And if so, Mr. President, what would be your message to those states that have not? Okay.
So that's why the Vice President and the President yesterday issued those critical guidelines. As I said this morning on Fox and Friends, you can look at them as guidelines, you can look at them as requirements, and you can look at them as the President asking every American in every state to follow those. That's why we put them out at the federal level. We wanted to make sure every American knew what they could do today to change the course of this epidemic. I think it's empowering. I think it says all of us have a social responsibility to each other, and that's why we believe that every mayor and every governor should be instituting these guidelines that came from the White House and the President of the United States.
And we've been very tough in those states. I know exactly who you're talking about. We've been very tough in them. Thank you. Please, go ahead.
A follow-up question on the testing. You've been telling us for days now that millions of tests have been sent out. So why have fewer than 60,000 people actually been tested?
I think you will see different numbers this week. You heard just at 8,000. Remember, all of these tests, the high-speed tests, were approved last Friday night, and last Thursday night. I think if I could talk to Thermo Fisher and the other groups that have these platforms out there, do not rely on a pull technology, push out those tests. Because we can only make them available, groups have to order them. So we've been talking to Thermo Fisher, one of the key platforms, to push out tests based on need and not wait for orders.
And is that where the issue is, getting the tests out, or is it getting the tests conducted?
That's a great question. I know part of it is getting the test out right now. I think the Admiral and others are working on getting the issues related to getting the test conducted. Obviously, that does take time. He is working on innovative solutions that are creative and sustainable that will be a game changer in testing, but we don't have the data yet. This is a critical comparator. Can you do it yourself? Can you actually sample yourself? These are the kinds of things we're working on right now, and he's getting the data for us.
And the states are actually doing a lot of it. The governors and the states are doing a lot of it, with even our tests. Yeah, go ahead. Go ahead, please.
Okay, thank you. Can you give us a sense of how long these tough new restrictions will need to be in place until we start to see the rate of this virus going down? And also, can you speak to this study that as many as 2.2 million people in the United States could die if there weren't this type of action by the government taken? To what extent did that prompt what we saw yesterday?
I think, models are models, and they're based on input, and they're based on infectiousness without any controls. I can tell you we've never seen that level of infections that modeled up to that 2.2 million in mortality. So we are looking at that. We are having a particularly model meeting tomorrow. I think that's really going to be important. I've dealt with a lot of modelers in my time. They're wonderful people. But they all have their favorite inputs and they all have their favorite integration functions. So we're evaluating all of those so we can integrate and create the best model for the United States based on the best data. And that first set of recommendations you saw were based on what we could do today to prevent anything that looks like that. If I could just say one other thing to the hospitals and dentists out there. Things that don't need to be done over the next 2 weeks, don't get it done. If you're a person with an elective surgery, you don't want to go into a hospital right now. There's a lot of distraction. There's a lot of people doing a lot of other things to save people's lives. So let's all be responsible and cancel things that we can cancel to really free up hospital beds and space. And then let's do everything that we can to ensure that we don't need the ventilators because we protected the people who would have needed to use them.
And are you looking at the possibility of more actions like, for example, limiting travel within the United States? Are you looking
It's possible. It's possible. We'll see how it goes. I think there's been great cooperation with local governments, states. We'll see how it goes. It's going right now pretty well. Yeah, please, go ahead.
Can I follow on that, Mr. President,
Please,
very quickly?
yeah.
Just very quickly. Do you need to invoke the Defense Production Act to get more of those medical supplies to different hospitals?
Well, we're able to do that if we have to. Right now, we haven't had to, but it's certainly ready. If I want it, we can do it very quickly. We've studied it very closely over 2 weeks ago, actually. We'll make that decision pretty quickly if we need it. We hope we don't need it. It's a big step.
Need more help from the federal government when it comes to those supplies.
You know, when you
What do
say the
to
states,
those governors?
in particular, 3 states need some help, and some states, have 2 people, 3 people, no people, in the case of, again, West Virginia. So we're looking at it very closely. We've taken it apart 15 different ways. It's a very difficult to do. It's a very big step, and if we need that step, we'll take it. Okay?
Quick follow-on, Kristen's first question. A lot of people have got travel to places that aren't considered hotspots, Caribbean, Mexico, that sort of thing, over the next few weeks. Would you recommend that they follow through with those plans?
I would just say, enjoy your home. Stay. I would just say right now, we have to get this problem fixed, and then we'll get back into business really quick. We'll open up our country, we'll open up our society, the world will hopefully open up. We see areas of the world that haven't done well, and we see areas that are doing very well, and I would put us in the category of doing very well for a country so big. I think that I would recommend that they just enjoy their living room. John? Yeah, go ahead, please.
What do you say to people who are not heeding these guidelines from the White House? And then also I have a question on asymptomatic people that Dr. Burks.
I'm not happy with those people if they're not. But those people are being shouted down by other people. They know it. They're being, it's almost like self-policing. People went in, there are a couple of instances, I guess, probably more than a couple, where people are not happy when they see others doing what they're not supposed to be doing. We have to get rid of this. We have to win this war, and ideally quickly, because the longer it takes, it's not a good situation. And I'm not even talking about the economy. I'm talking about the lives of a lot of people. Yeah, please, did you have one?
Will the White House put any restrictions on corporate bonuses for companies that do get bailed out like airlines?
I'm going to ask, I think I'm going to ask Mike, answer that question.
I think it's all a work in progress. What President Trump has made clear to industries around the country is that we're going to do whatever it takes. We understand this is an extraordinary moment in the life of our nation. It's the reason why the President brought in leaders of the financial sector, airline industry. He'll meet with all additional industry leaders today in tourism and hospitality. But he has tasked the Secretary of the Treasury to work with members of Congress in both parties to make sure that we construct the kind of economic support that will allow those industries to weather the period of the coronavirus and then to come back stronger than ever before.
Question for Dr. We've had such incredible, I don't know, it's almost the word spirit is the best word. It's like a spirit. The banks have come in, and the banks are doing things that they would have never done. They're working on extensions and lots of things that they wouldn't have done. Co-pays with regard to the insurance companies. I mean, for them to be doing what they're doing, you know all about the co-pays. They would have never done that, and they did it. They were in my office. They, I would say, the 11 biggest in this country, I guess probably the 11 biggest in the world, the big ones, all the big ones, and they did things on copay that nobody would be doing, that they wouldn't have done in a million years, but they're doing it. There's a great spirit going on right now in the country. So you want to, yes, please.
Dr. Fauci, you've said you like being accused of overreacting. because that is an indication we may be doing things necessary to beat this, bend the curve. How long do you think it will take for you to be confident that, yes, we're bending the curve, or no, we're not?
You know, I can't give you a firm number on that because the dynamics of outbreaks, in some respects, are predictable historically. They do this and that. We don't know because this is really unprecedented. I mean, of all the outbreaks that I've been involved with over the last at least 36 years, and then going historically back, we've never had a situation where the mobilization of all the different components, travel restrictions, internal containment, mitigation, financial assistance, public health assistance, testing. So we don't really know. But the one thing I do know that if you look at models with all of their vicissitudes of models, is that when you have input into the kinds of mitigations and things that we're doing, we're going to see a hump instead of a peak. I would be really surprised if all the things that we're doing, and this is really a comprehensive approach. I was struck as I was listening to everyone make their presentations that, you know, I'm a scientist, I'm a health person, and I'm a physician who sees patients. So I look at it from one particular standpoint. But what I'm being impressed by is that this is really a comprehensive thing that has multiple components to it. All of them got to succeed if we're going to get to that end point that I've described multiple times from this podium. So I hope that if everyone does their job, we're going to be able to give you a number and say, you know, we've seen that inflection and we're coming down. I would hesitate to do it now, to be honest with you, because it might be misleading, and I don't want to be misleading. I just want to say one other thing, because I heard Dr. Burke say it, and I think we need to say it over and over again. When I was young, a long time ago, I felt that I was invulnerable, the way I think many of us feel we're invulnerable. And when we're asking the young people to help us with this mitigation strategy, by staying out of the bars, staying out of the restaurants, really trying to distance yourself, don't get the attitude, well, I'm young, I'm invulnerable. You are, well, in some respects, you're certainly less vulnerable than I am. However, what you might inadvertently do, and I know you don't want to do that, you don't want to put your loved ones at risk, particularly the ones who are elderly and the ones who have compromised conditions. We can't do this without the young people cooperating. Please cooperate with us. Thank you.
Dr. Fauci, and I'm going to read my notes so I get this right, but there's apparently a new study out of China. It found that the vast majority of cases, 86%, were in untested patients with mild to no symptoms. So what does that say about the impact of testing, and does it mean that testing should actually go beyond the sickest patients?
You know, that question keeps coming up, and I'm not going to evade the question, but I want to make a point. We tend to think that we're not going to be able to mitigate or contain without testing. They complement each other in some respects, but they're separate channels. Even if we had no testing, we should be doing what we're doing now. The question you're asking, so I won't evade it specifically, would it be important outside of a doctor-patient coming in together, of knowing what's out there, what might be under the radar screen? The answer to your question is yes. So let me tell you what the CDC is doing right now. They're going out there, and part of their program is to get a feel for what is there that wasn't initially thought to be coronavirus, that was thought to be something else. When you do that, you're also going to get a feel of what the penetrance is in society. So we are heading with the high throughput things that you've been hearing about to get an answer to your question.
Dr. Fauci, Governor Cuomo said this morning he believes that we'll see a peak in terms of infection in 45 days. Would you concur with that?
You know, it's possible. I mean, I know that the governor has been really, I believe, doing a really good job of trying to stay ahead of this. 45 days is not unreasonable. You have to be careful. When you get a number, you own the number, and then if the number doesn't come out, you're in trouble. And that's the reason why, from our standpoint, from the federal government, we're talking about a range. So within that range, I mean, it isn't like you want to be correct for the sake of being correct, but you don't want to be wed to something and then have to back off.
Go ahead, please.
When is the soonest that we'll know that these new guidelines are actually bending the curve or actually working? And is there a point in time where in the next couple of weeks, where you'll be able to tell the president more draconian measures are needed?
Well, okay, so what's happening, I mean, if you look as a metaphor, it's kind of like a race against the virus. If left to its own devices, will do this. And us trying to somehow blunt that. Now, you could see the virus going up and up, and your effect, your work, what you're trying to do, may actually be having an effect. But you may not see it because it'll still be going up. And as you're trying to implement your interference with the virus, you may not realize that you're actually interfering. And you'll say, wait a minute, it's still going up. What's going on? You've done nothing. But you don't know whether it would do this versus that. So the answer to your question, it probably would be several weeks and maybe longer before we know whether we're having an effect. It may be at the end of the day, we'll see a curve that would have been way, way up. But I wouldn't put us to task every few days. Well, wait a minute, it's going up. Is it working or not? That would be really misleading if we do that.
Go ahead. Regarding the 15-day guidelines which were announced yesterday. One of those guidelines was a recommendation against gatherings of 10 or more people. And today, the governor of Alabama issued her own guidelines, and it was a recommendation against gatherings of 25 or more people. What is your recommendation for people of Alabama, people across all of the country, as far as the guidelines that were announced yesterday by the federal government?
Okay, so the one thing we don't want to do is to get hung up on the difference between 10 and 25. I think you might agree with that. When we give guidelines, they're only guidelines. We sit down, we look at the data, as Dr. Burke said, we're data-driven, and we say, on different models, 10 looks good. If someone wants to do 25, we're not going to fault them, but if someone wants to come to us and ask us what we think the best is, we stand by the numbers. It isn't perfect, it isn't precise math, it's assumptions and it's data that make you get your decision.
But would it be more effective if every state and every city in the country was playing by the same rules instead of different?
Of course. But this is the United States of America. There's a lot of free enterprise there. People do their own thing. And quite frankly, I don't think there's a big deal difference between 10 and 25. We got many, many more important things to worry about than that difference.
Mr. President, thank you. Going back to supply chains and then talking about preparedness for the future, yesterday Larry Kudlow said that there is an idea floating around the administration to cut taxes for companies who would be bringing their supply chains back to the United States. He said he specifically liked immediate 100% write-offs for structures, equipment, but he said you hadn't endorsed that yet. Would you endorse an idea like that?
We're looking at many ideas. That's one of them, frankly, and we're looking at creating incentives for companies, not only that type of company, but other companies. We're also looking to help companies such as the airline industry within the airline industry, and we'll be doing that. We will be doing that. This is not their fault. And they've been very understanding, actually, and we're going to be helping them. We will have a very powerful airline industry, and it'll start up as soon as this is over. We'll have those planes ready to go. So we have to help them during the short term. We're very important. Yeah, please.
Thank you, Mr. President. I wanted to know, have you taken a look at some of these models, such as the Imperial College London model, that kind of poses a very difficult choice, whether it's shutting down society or overwhelming the healthcare system? Is that something that
we've looked at every model? We've relied on the very talented people, and there's no better team than the people behind me. And I will say that all of the people that have done those models are all in constant touch with Dr. Burks and Tony and everybody that you've been hearing so much from over the last couple of weeks. We've looked at many different models, and the model we have is we want to save a lot of lives. We want to save a lot of lives. If we get too steep on that curve, you're going to lose a lot of lives, perhaps unnecessarily. Now, we're going to find out. Everything has a risk. We're going to see. But if people do what we're telling them to do, what we're asking them to do, you're going to see the saving of a lot of lives. Now, Boris, in UK yesterday, you saw what happened. It looked like they were going a different way, but then he went a way of similar I guess similar, I don't know exactly, but I would say we had a conversation yesterday similar to what we're doing. So a lot of people seem to think this is going to be, we are looking to save the maximum number of lives. Everything else is going to come back. A life is never going to come back, but everything else, our economy is going to come roaring back. You're going to know, we're going to know, we're going to all know that day. Somebody was asking about the day. When will you know? When will you know? We're going to know. All of a sudden, we're going to say, wow, that's looking good, that's looking good, that's looking good, and we're going to be on the other side of the curve, and that's a day that we look forward to. Okay?
Something, sir, that you saw this week, though, that made you decide that, yes, now is the time to implement these much more stringent social distancing measures?
No, I don't think so. This is where we were going. I really think from the beginning, this is where we were going. This is what we had in mind. We're just going step by step. That was the next step, the next logical step. As Dr. Fauci said, and I think very importantly, one of the most important things when you write the history of this was the fact that we closed it down to China and Europe, but in particular China. We closed it down to China, the source, very, very early, very, very early, far earlier than even the great professionals wanted to do. And I think in the end, that's going to be, that will have saved a tremendous number of lives.
Follow up, one on the economy and the other on the broader picture here, but just to follow up on my colleague, some people did note that your tone seemed more somber yesterday. You talked about that August timeline. Did you see a projection? Some people thought perhaps that 2 million potentially that could die maybe prompted part of that. Was there a shift in tone?
I didn't think, I mean, I have seen that where people actually liked it, but I didn't feel different. I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. I think now it's in almost 120 countries all over the world. No, I've always viewed it as very serious. There was no difference yesterday from days before. I feel the tone is similar, but some people said it wasn't.
Last one on the economy. Your former economic advisor said almost 100% chance of a recession. Do you see it that way?
It could be. I mean, I don't think in terms of recession. I think in terms of getting it out, because when we're finished with the virus, we will win. We will win. And when that victory takes place, our economy is going to go through the roof. It is so pent up. It is so built up. It is so ready to go in an upward direction. But we have to knock out this enemy. This is a really tough enemy, but we have to knock out all of us. That's all of us. So I don't think in terms of recession, not recession. It's words. We have to knock out this, and we will have an economy. I actually think we'll have an economy like we've never had before. It's all pent up. Did you have something to say, Mike? Yes.
Well, I think the question about the actions that the President's authorized, beginning in January, when he took the unprecedented step of suspending all travel from China, the efforts to issue travel advisories for portions of Italy and South Korea, and then to begin screening all the passengers, the efforts regarding suspending travel from Europe and what went into effect at midnight last night, adding the UK and Ireland to that, have all been informed by the experts that are surrounding us. What the President's asked us to do from the very beginning, as Dr. Birx and Dr. Fauci often say, is let's follow the data, bring the President the best options in response to what is actually happening on the ground. But with regard to yesterday's 15-day slow the spread plan, our team unanimously brought to the President these very strong recommendations for every American, because we truly believe we are at a point in this epidemic in our country when we can reduce the number of people that actually are exposed to or contract the coronavirus. But we'll continue to bring the best data, the best evidence, and the best recommendations, frankly, of the best health experts in the world, and the President will continue to make decisions that put the health of America first.
In other words, reduce the number of people that die. That's what we're trying to do. And when you do the steep curve, a lot of people are going to die. A lot of people. You know, the worst ever, they say 1918, and I don't have to go into the numbers, but they were unbelievable numbers. Had they known and had they done what we had now, it would have been a very much different story. It would still be tragic, but it would have been a very much different. But that was the one that people write about. That was an incredible pandemic, like we haven't seen. But we have we have done something that hopefully we will all have made the right moves. We're all in this together, including you, and we want to see fair press. And I tell you what, it's been, generally speaking, I think it's been a great thing to see. It's been very, very, getting along with Democrats, getting along with Republicans, for the Democrats themselves. There's been a lot of spirit. There's been a lot of things happening that I haven't seen happen in the first almost now 3.5 years. It's been very nice to see. That's one of the good things. But what really the good thing is, we have to knock it out. We have to win. And we want to keep that slope as low as possible, because that's a lot of lives in there. Let's go back there. Somebody that didn't get one, please. Go ahead.
Mr. President, this has had a huge impact on China's economy as well. Have you received any indication from officials there that they're going to have trouble meeting the purchase agreements, part of the Phase 1 deal, particularly the agricultural buy?
Well, they need our product very badly. And no, I haven't received any. We have a good relationship with China. I have not received anything to that. No, we have a signed agreement. They're going to be buying, and they have been buying a lot of product. Yeah, please.
Earlier today, Dr. Birx was talking about the possibility of our hospital system being overburdened, overtaxed, and she talked about certain options that are available to the United States if that happens, including VA hospitals, Department of Defense medical treatment facilities, and even hospital ships. At what point do you tap into those options?
Well, I'll know the point, and by speaking with Governor Cuomo and other governors, we're going to know the points. It's going to be different for New York than it's going to be from, Iowa, or from Idaho, or from West Virginia, frankly, or for, it's different. New York has got a big problem. The state of Washington has a big problem. California has some big problems. Everyone's doing a good job, but we're going to know when it will be, and I believe it'll be more spot than it will be. It's not going to be the whole thing. It's going to be spots. There are some hot spots that are in trouble, big trouble, and there are other areas that are in no trouble at all. They watch it on television. They don't know. It's just not affecting them, and they're lucky. They're lucky, but there are areas of the country that don't have much of a problem, and some that don't have any problem. They're not going to have a problem with hospitals, but some areas like New York, California, state of Washington, they're going to have some difficulty. And when we see that coming, we're going to be in there. We're already making preparation for it.
Senator Marco Rubio of Florida, your trade advisor, Peter Navarro, have been recommending an executive order that would ensure that the raw materials for pharmaceuticals and medical devices are manufactured here in the United States. We were getting some indications last week that you were close to signing this executive order. Can you tell us?
Well, we're looking at different things, John. I don't want to say exactly. Right now, China's been sending us everything we need, but we're looking at some alternatives. Yes, we are looking for alternatives. And we have other places. Ireland does a lot of work for us. You know that in that world, in the pharma world, a very tremendous producer, and we are looking to bring a lot more back home. And excuse me, you know me for a long time. I've been talking about this for many years, long before I decided to run for president. I've been talking about this, and we have to be able to take care of our country. And that was one of the many things on the list. So we'll be talking about it. But we are discussing it, and Marco is very much involved, and Peter is very much involved. A lot of people are involved, and a lot of people feel that way, but we'll be discussing. Let's go, please.
Thank you, sir. You said Canada has closed its border to non-citizens. Are you considering...
Not to the United States.
Not to the United States, of course. Are you considering closing the land borders in the United States? And also, you've discussed...
Well, Canada has not closed it to the United States, right. So we're working very closely with Canada, but they have not closed it. They have closed it to the world, but they have not closed it to the United States.
Are you considering closing the U.S. land borders?
I don't want to say that, but we are discussing things with Canada, and we're discussing things with Mexico, quite honestly. And again, the relationship is outstanding with both. Outstanding. We just signed our deal, USMCA, and the relationship is very strong. Go ahead, please.
China and others have criticized you for using the phrase Chinese virus. How do you feel about that? Are you going to continue using that phrase?
Well, China was putting out information which was false, that our military gave this to them. That was false. And rather than having an argument, I said, I have to call it where it came from. It did come from China. So I think it's a very accurate term. But no, I didn't appreciate the fact that China was saying that our military gave it to them. Our military did not give it to anybody.
Critics say using that phrase creates a stigma
No, I don't think so. No, I think saying that our military gave it to them creates a stigma.
Mr. President,
Please.
when you speak to travel and tourism executives today, what specific help are you going to offer to them, if at all, or is it still vague?
Well, we're going to help. They need help. Look, let's face it. You know, they go from having record-breaking years. This is the third year of record-breaking years, travel and tourism, airlines, everything. They were doing record numbers, ordering new planes, building new hotels. Everything was really hunky-dory. And then one day, we hear about this rumor in China, and then we find out it's much more than a rumor. And then all of a sudden, we make a great decision to close it up early. It would be a whole different world. It would be a whole different world. But we make a decision to close it up to China, and all of a sudden, tourism, and then we close it up to Europe, which, you know, people never heard of this before. I'm not sure that that's ever been done. I know that when I made the decision to close it to China, people told me that's never been done before, but it was a great decision. We make good decisions. So I'll tell you my best decision. The people behind me are total pros. All over the world, they're respected. Dr. Birx, Anthony, who's become where's Anthony? He's become a major television star for all the right reasons. No, he's just so professional, so good. The people that we have working here have been incredible, and they're totally respected. The Admiral has been incredible, having to do with the testing, incredible, and he's viewing this as testing also for the future. We're building a platform. When we took over this platform, first thing the Admiral said was, this was not designed for what we're talking about, millions of people. It wasn't, and it's nobody's fault. It's not like, who could have ever predicted a thing like this? But we broke it down, and it's really going to be an incredible system, and it is now a great system. I just want to say, these are incredible people standing behind me. They're the most respected in the world. Every country that you've mentioned today so far has called them, and they call them all the time for advice. There's nobody better than what we have.
Mr. President, why haven't we seen Dr. Redfield?
Say it?
Why haven't we seen Dr. Redfield the last couple of days?
I don't know. I can't
He's in
imagine.
Atlanta, running the CDC.
I can tell you he's doing a good job. We're very happy with him.
Mr.
Yeah, please, you have it. Go ahead.
Mr. President, yesterday we were being told that the payroll tax was going to comprise the lion's share of fiscal stimulus.
Right.
We also had the markets fall quite dramatically yesterday, and did that inform?
It wasn't about the payroll tax.
Did that inform your decision? What made you make that change, and when did you make that change?
Well, I didn't make a change. We're looking at payroll tax, and we're looking at various other forms of getting money to people. And the payroll tax is something that I've always liked. The problem is it does take a period of time, months, before they really see something. And we don't really have months in terms of people living. A lot of these, you have people that work on tips. You have people it's a large number of people. It's a tremendous, who would think this, right? And they do nicely. They work very hard, but they work on tips. We have to take care of our people. We don't want to have people suffering during this period. It wasn't their fault that this thing all of a sudden was upon us. So we're looking at we're also looking at payroll tax. It's possible. It's also possible we'll do a percentage of payroll tax and then other things. But we'd like to be able to get money to people. We're very lucky. Our country's doing so well. We can do this, and we can do it easily, but we have to do it. And I have to say, Mitch McConnell, if you look at Mitch and Kevin and the whole group, and it's been incredible how they're reacting, how Congress is reacting, how, whether it's the House or Senate, how they're moving. And I'm talking about Democrats and Republicans, but we've had tremendous leadership meetings, and they want to see it done right. And they do want to go big. I think going big is important. I don't think we want to go up there every day with a different idea, different concept. Oh, gee, let's worry about the airlines. Let's do this one. You have a big problem with the cruise ship industry. It's an industry that was setting all sorts of records 2 months ago. Then all of a sudden, there's nobody on the ships, okay? So we have to help these. These are great industries. These are going to be taking care of people and passengers and for years to come, and paying tremendous taxes for years to come. So we have to make sure that this is done. Yes, John?
Mr. President, I want to bring up what you referred to just a short while ago about politics. In your address to the nation, you said we have to put politics aside, stop the partisanship, and unify together. This morning, you criticized the Democratic governor of Michigan. Yesterday, it was the Democratic governor of New York. You've attacked Obama. You've attacked Biden. In fact, every day except one since that address, you've lashed out at a Democratic leader. Are you going to set the example?
I only do that when I have to respond. I watched her on television. She said something that was false, and therefore I did do that. And I will continue to do that. If they're not going to play fair, because, they have the media on their side, I don't. I just have me. And if they're not going to play fair, I'm going to do that. If they are going to play fair, there's going to be nobody better than Donald Trump in terms of bipartisanship. But if they're going to say things that are false, like the story that was written yesterday, a lot of people, I don't know, somebody, I think I know who, but they taped the conference call that I had with the governors. It was a good call. It was fine. I assume somebody's going to tape it. They handed it to various people. One of them was the New York Times, and the New York Times chose to write totally inaccurately about it. It was a disgraceful thing. It was bad journalism, but, they do a lot of bad journalism. But we respond to that. And actually, people get it. People get it. No, I want it to be bipartisan, and nobody's going to be better than me. But when they attack me or the people, these incredible people behind me, I'm not going to let them get away with it. I can't do that. Okay, how about one or two more questions? Go ahead, please.
Follow up on the 15-day
Please.
guidelines was the next natural step. So is the next natural step after that a national lockdown similar to what San Francisco is doing?
Well, you can do a national lockdown. Hopefully, we're not going to need that. We think of everything. I mean, we have every idea that you mentioned we've thought of, and, it's a very big step. That's a step that, in one sense would work. It's a very big step. It's something we talk about, but we haven't decided to do that. Please, go ahead.
Mr. President, what would be the determining factors for you to take that action?
It would have to get to a level, I just don't think it's going to be an action that we're going to take. I don't think I'll talk, but Anthony, all of the people standing behind me would get together in a room, plus some additionals, and we would make a decision. But I don't think that's a step that we're going to be taking. But one more question. You didn't have one, did you? Come on.
Will the U.S. government provide financial assistance to Boeing and airplane suppliers like GE?
We're looking at that. We're certainly looking at Boeing. Boeing got hit hard in many different ways. Boeing never had a problem for years. They were it was unthinkable what happened with respect to Boeing. Unthinkable. Probably, I would consider it the greatest company in the world prior to a year ago. Now they get hit in 15 different ways, and they have different management. I've met the new people running Boeing. I think it's going to be outstanding. But yeah, we have to protect Boeing. We have to absolutely help Boeing. They were doing a job. It was coming along well. And then all of a sudden this hits. So obviously when the airlines aren't doing well, Boeing's not going to be doing well. So we'll be helping Boeing, yeah.
Can you just respond to something, Mr. President, before you leave, on what John was saying? You've called for people to leave politics out of this. Joe Biden said the World Health Organization offered testing kits that they had available to the United States, and to give it to us now, we refused it. We didn't want to buy them. PolitiFact says the WHO never made that offer. Can you tell us?
Well, that's what I heard, and I'm going to let Tony answer that question, or whoever's best at answering that. But I do have to say, when you talk about politics, I watched the debate. Not too exciting, but what they said about me, and we've done a great job. When you talk about not being bipartisan, what they said about me, and if you look at swine flu, the whole thing, and I guess it was 2009, and what they did and the mistakes they've made, they were terrible. They were horrific mistakes. 17,000 people died. And I'll be honest, they shouldn't be criticizing because we've done a fantastic job. The only thing we haven't done well is to get good press. We've done a fantastic job, but it hasn't been appreciated. Even the closing down of the borders, which had never been done, and not only did we close them, but we closed them early. The press doesn't like writing about it. So we've done a poor job on press relationships, and I guess I don't know who to blame for that. I don't know. Maybe I can blame ourselves for that. I will blame ourselves, but I think we've done a great job. I think we've done a poor job in terms of press relationship. But let me have somebody answer your question.
Yeah. So I tried to cover this in the answer when I talked about quality of kits, and our quality analysis runs through the FDA. So all of these platforms, we have asked people to submit, and we've asked states to quality control. So Anybody could submit their test to us. We don't buy tests that haven't been quality controlled, and they show us the data. Either show us the data up front or show us the data after they've been running them. Because quality testing for our American people is paramount to us. It doesn't help to put out a test where 50% or 47% are false positives. Imagine what that would mean to the American people. Imagine their level of concern now and telling people that they're false positive. We take this same approach to HIV. Imagine telling someone they were positive to HIV and they weren't. So that is our bottom line, the customer, the American people first. And so any of these groups can submit their testing kits through our regulatory processes. But without that and without a plan, we are not going to accept tests that have not been studied by us.
Good answer. It's a good answer. Would you have something on that?
I'm just going to emphasize a little bit more on that. When I became involved in the testing world, I called as senior officials at the WHO as I could find to understand what the situation was. And as far as I can tell from sources that should know, no one ever offered a test that we refused.
That's what I heard too.
This is a research grade test, right? Research grade test that was never submitted, not approved, not submitted to the FDA, that was supplied in tens of thousands of quantities to 100 countries in the world, okay? So I think there's a lot that people are saying about this that's just based on rumor and myth. Nothing was offered that we refused. It was a research test that was not approved. And again, there was a small number that we have greatly surpassed in a very short period of time.
So number one, nothing was offered. Number two, it was a bad test. Otherwise, it was wonderful. Listen, thank you very much. No, he made a mistake. I assume that he'll apologize. He made a mistake. Thank you all very much. Thank you. We'll be back. Oh, thank you very much. Thank you very much. And thank you very much also to a man named Matt Schlapp. What a job he's done. And to CPAC, I actually started quite a while ago in CPAC and came here, probably made my first real political speech, and I enjoyed it so much that I came back for a second one, then a third, then I said, what the hell, let's run for president, right? But it's wonderful to be back with so many great patriots, old friends, and brave, young conservatives. What a future you have. Our movement and our future in our country is unlimited. What we've done together has never been done in the history, maybe of beyond our country, maybe in the history of the world. They came from the mountains and the valleys and the cities. They came from all over. And what we did in 2016, the election we call it with a capital E, it's never been done before, and we're going to do it, I think, again in 2020, and the numbers are going to be even bigger. And we all had to endure as I was running. So you had 17 Republicans plus me. And I was probably more of a conservative than a Republican. People just didn't quite understand that. They didn't understand it. I think now with what we've done with the judiciary and so many other things, I think they get it very well. And it's driving the other side crazy. But we all had to endure, remember? How many times did you hear for months and months, there is no way to 270? You know what that means, right? There is no way to 270. They couldn't get me there. We might as well have just given up. But there wasn't any way to 270. In fact, I actually went up to Maine to get one, and I did win the one, but we didn't need the one. We won Maine. We won our half of Maine. Remember, you have Nebraska. We won both in Nebraska. We won the half we had to win in Maine. So we got the one, but we didn't need the one because we didn't get 270. We got 306 to 223. 223, 306. A state called Wisconsin, a state called Michigan, where, by the way, where Fiat Chrysler just announced a $4.5 billion incredible expansion and new plant, doubling their workforce. Many, many car companies have moved back to Michigan and are continuing to do so. Big numbers. Nobody ever thought they'd see that happen. So I think we're going to do even better in 2020. I think we're going to do numbers that people haven't seen for a long time. The men and women here today are on the front lines of protecting America's interest, defending America's value, and reclaiming our nation's priceless heritage. It's true. With your help, we are reversing decades of blunders and betrayals. These are serious, serious betrayals to our nation and to everything we stand for. It's been done by the failed ruling class that enriched foreign countries at our expense. It wasn't America first. In many cases, it was America last. Those days are over, long over. America is winning again. America is respected again. And the world knows it. When I meet with prime ministers, when I meet with presidents, and I get along with them, because they know that what's taken place over many years, not just the Obama administration, long before that, they can't believe themselves that they got away with it. They can't believe it. An impossible thing. And they like me. And the reason they like me, they tell me. They say, Mr. President, I said, as an example, President Xi of China, I have great respect, we have a great relationship. I say, how is it possible that you got away with this for so long? And he said, because nobody ever asked us to change. It's true. When they charge 40% tariffs on our cars going into China, and we charge them nothing coming into our country, when they raise their tariff from 10% to 25% and then to 40%, and they said to me, we expected that somebody would call and say, you can't do that. Nobody called, so we just left it. And I don't blame them. We should have been doing the same thing to them, but we didn't. True. Right? Hard to believe. It's hard to believe. But now things are different. Now we're negotiating with China. They wouldn't negotiate with previous administrations. But I found some very old laws from when our country was rich, really rich. The old tariff laws, we had to dust them off. You could hardly see, they were so dusty. But fortunately, they weren't terminated. We started getting politically correct even back then. But I said, when we were doing the great things, what happened to those laws? And I checked, and I found 301 and 382. I found one 1938 where we could do what we have to do. But you know, they had a debate, it was really a rough time in our country because we had so much money, we didn't know what the hell to do with it. Tough time. It was called the Great Tariff Debate. Mark Levin will look this up. And the problem is with Mark, if I make a little mistake, he'll let us know on Sunday night. I got to be very careful when I talk about this. But it was the Great Tariff Debate of 1888. And the debate was we didn't know what to do with all the money we were making. We were so rich. And McKinley, prior to being president, he was very strong on protecting our assets, protecting our country. And he made statements that others cannot come into our country and steal our wealth and steal our jobs and build their country and not defend our country. We can't do that. We can't ever allow that to happen. And you know, I don't know, maybe you know, I'm totally off script, right? Thank you, darling. You know I'm totally off script right now. And this is how I got elected, by being off script. True. And if we don't go off script, our country's in big trouble, folks, because we have to get it back. And when I look at what's happening on the other side, I encourage it. I say, no, I think the new Green Deal, or whatever the hell they call it, the Green New Deal, right? Green New Deal. I encourage it. I think it's really something that they should promote. They should work hard on. It's something our country needs desperately. They have to go out and get it. But I'll take the other side of that argument only because I'm mandated to. But they should stay with that argument. Never change. Never change. No planes. No energy. When the wind stops blowing, that's the end of your electric. Let's hurry up. Darling, is the wind blowing today? I'd like to watch television, darling. No, but it's true. So the Great Tariff Debate of 1888, and then we had so much money. We could do whatever we wanted. We built forces up that were incredible. Then in 1913, they ended tariffs, okay? They ended tariffs. Somebody got stupid, and they ended tariffs. They said, oh, it's okay for other nations to come in. I won't use a certain word because it's not politically, but everybody knows the word I'd love to use. Should I use it? I won't do it. Our great First Lady always said, don't use certain words, please. I say, but the audience wanted me to do it. She said, don't do it. And the problem is, if I do that, they won't put the little preamble that we just went through. They'll just use the word, and they'll say, isn't that terrible? So I won't use it. I've learned Because with the fake news, if you tell a joke, if you're sarcastic, if you're having fun with the audience, if you're in live television with millions of people and 25,000 people in an arena, and if you say something like, Russia, please, if you can, get us Hillary Clinton's emails. Please, Russia, please. Please get us the emails. Please. So everybody's having a good time. I'm laughing. We're all having fun. And then that fake CNN and others say, he asked Russia to go get the emails. Horrible. I mean, I saw it like 2 weeks ago. I'm watching, and they're talking about one of the points. He asked Russia for the emails. These people are sick, and I'm telling you, they know the game. They know the game. And they play it dirty, dirtier than anybody's ever played the game. Dirtier than it's ever been played. But the thing that we've done is very special, because on trade and because of tariffs, and I know there are people in the Republican Party and people, really even conservatives, good conservatives, they don't like tariffs. I'm not liking or not liking. The minimum, the greatest negotiating tool in the history of our country. Do you think China would be sending their top representatives over? Right now, China's paying 25% tariff on $50 billion worth of technology goods. I was then going to charge them 25% on $200 billion. Not like 200 million, that's a lot. This is 200 with a B, billion. 200 billion. So, but I was nice because we're having a very strong negotiation, which, if it weren't for tariffs, and I tell this to President Xi, this is nothing to hide. I would never be talking like this because, in theory, it could hurt your negotiating position, but in my case, it can't, because it's true. I was nice, and I left it at 10% on 200 billion, and here's the beauty. We've lost so much money with China, $500 billion a year, and on trade is such a disaster. It's $507 billion a year. China, just one country. We lose with everybody, almost. But China's one country. $507 billion for many years. So the beauty is this. I have $250 billion more to put tariffs on. The numbers are staggering. Billions of dollars right now are pouring into our treasury. And for those of you that haven't done the research, if you look, of the 25%, our country, as it's turned out, because it's now been on there for a long while, and I'm in no rush because I'm fine with it. I'm fine with it. Of the 25 points, we've paid for 4 points, and China's paid for 21 points. Okay, 21. That's what the numbers are. It's very simple. You know, everyone said, oh, it's a tax on our... It's not really. And what China and other countries do sometimes is they will subsidize it. So the tax really is incredible. But what it is beyond everything else, I can negotiate. But then you have senators and a few congressmen, but not Mark Meadows. Where's the great Mark Meadows? He's here somewhere. Man, has he been good? Mark and Jim Jordan, and I want to name every one of those couple of hundred people, because we do have a lot. I want to name every damn one of them. They have been incredible. They've been fighting, and I just see Mark in the audience. They've been fighting with Deb, much more important. His wife is incredible. What an asset. He would be nowhere without her. Right? But they fight so hard on this witch hunt, this phony deal that they put together. this phony thing that now looks like it's dying, so they don't have anything with Russia. There's no collusion. So now they go and morph into, let's inspect every deal he's ever done. We're going to go into his finances. We're going to check his deals. We're going to check. These people are sick. They're sick. I saw a little Shifty Schiff yesterday. No, it's the first time. He went into a meeting and he said, we're going to look into his finances. I said, where did that come from? He always talked about Russia. Collusion with Russia. The collusion delusion. So now we're waiting for a report, and we'll find out whether or not, and who we're dealing with. We're waiting for a report by people that weren't elected. Think of this, we had the greatest election. In all fairness, I used to hear Andrew Jackson. This was now greater than the election of Andrew Jackson. People say that. No, people say it. I'm not saying it. Right? This was the equivalent or greater. You know, they used to go to Ronald Reagan when I first started. This is Ronald Reagan. Then we started really doing well, and they were coming from everywhere to vote. Those red hats and white ones. The key isn't the color. The key is what it says. Make America great again. That's what it says. Right? Right? But we had the greatest of all time. Now we have people that lost. And unfortunately, you put the wrong people in a couple of positions, and they leave people for a long time that shouldn't be there. And all of a sudden, they're trying to take you out with bullshit, okay? With bullshit. Now, Robert Mueller never received a vote, and neither did the person that appointed him. And as you know, the Attorney General says, I'm going to recuse myself. I'm going to recuse. And I said, why the hell didn't he tell me that before I put him in? How do you recuse yourself? But the person that appointed Robert Mueller never received a vote. Robert Mueller put 13 of the angriest Democrats in the history of our country on the commission. Now, how do you do that? These are angry, angry people. You take a look at them. One of them was involved with the Hillary Clinton Foundation running it. Another one has perhaps the worst reputation of any human being I've ever seen. All killers. In fact, it would have been actually better for them if they put half and half, and Mueller can do whatever he wants anyway, which he'll probably do. But we have conflicts. I had a nasty business transaction with Robert Mueller a number of years ago. I said, why isn't that mentioned? He wanted the job as FBI director. I mean, these are things that are out there. They know it. Why isn't that, and I didn't give it to him, why isn't that mentioned? Jim Comey, Lion James Comey, is his best friend. James Comey is his best friend. And those are a few of the conflicts. Other than that, it's wonderful. So everybody's waiting. I thought of it this morning, Mark, and I heard you made an incredible speech and statement today, Mark Levin. I heard it was incredible. And I was on the way, but I'll see it later. I guarantee I'll be watching it later. I have one of the great inventions in history. It's called TiVo. I think it's actually better than television, because television is practically useless without TiVo, right? But I'll be watching it later, Mark. But people that got no votes. But I heard this morning, President Trump is waiting for the Mueller report. I said, wait a minute, let me get this straight. So the Attorney General recuses himself, and I don't fire him. No obstruction. That's the other thing. If you use your rights, if you use your power, if you use Article 2, it's called obstruction, but only for Trump, for nobody else. So the Attorney General is weak and ineffective, and he doesn't do what he should have done. Somebody that never got a vote writes a powerful letter, horrible, about Comey. Every single Democrat said Comey should be fired, or worse if possible. Every Republican said everybody, in fact, when I fired Comey, I said, you know, First Lady, I said, Melania, I'm doing something today. I'm doing it because it really has to be done. He's bad. He's a bad guy. That's been proven now with all of the emails and the text. I'm doing something that has to be done. But you know the good news? It's going to be bipartisan. It's going to be so popular. It's going to be bipartisan. Every Democrat hates him. Every Republican hates him. He did a horrible job at the FBI. Speak to the real agents, the real people, because the people in the FBI are incredible people, not the sleaze on top. And I said to the First Lady, I said, but you know the good news? The good news is that this is going to be so bipartisan, everyone's going to love it. So we fired Comey, and Schumer, who called for his resignation many times, Podesta, I believe that day, because he still hasn't gotten over getting his ass kicked, okay? I believe that day called for his resignation. That day, Podesta, the great genius of campaigns, he called for the Comey resignation. Others, almost every, I would say, Mark, would you say virtually every Democrat, virtually every, I can't think of anybody that said he's doing a good job. So I said to Melania, the good news, this will be a popular thing. And I fire a bad cop, I fire a dirty cop, and all of a sudden the Democrats say, how dare he fire him? How dare he do this? And that's where we are, folks. That's where we are. We're in this swamp of Washington, D.C. But you know what? We're winning, and they're not. We're winning, and they're not. So just to finish, I'll tell you, MatchLab is loving this. He's saying this is a lot more than we paid for. You know, normally you read a few pages and you say, bye, folks. But you know what I like about this? Number one, I'm in love, and you're in love. We're all in love together. We've done something that nobody's ever done, right? It's easy. No, it's easy. You know, a great friend of mine from New York, he's a stone-cold killer. He's a brutal man. He's actually not even a good friend of mine because he'd turn on me in 2 seconds if it was up. But he's a very rich guy. And he said, what are you going to speak about today? Like, what are you going to speak? I said, I don't know. He said, I just heard that you have the biggest crowd in the history of CPAC. They're all over. By the way, not only this giant room, they're in many hotel rooms all over the place. You're just better at real estate than they are. Yeah. But this guy, you all know his name, very rich guy, and he has a problem with a thing called public speaking. If he has to speak to more than like 5 people, he chokes. He can't breathe, you know. Are you okay? He kills people for a living, meaning mentally and financially. But if there's like an audience of 9, it's like... So he said to me, how the hell do you do that? And I said, it's easy. And the reason it's easy, I really mean this, There's so much love in this room. It's easy to talk. You can talk your heart out. You really can. There's love in this room. You can talk your heart out. It's easy. It's easy. It's easy. And we've had that from the day I came down with your First Lady on the escalator in Trump Tower. It's been easy. And you know what? We never had an empty seat. We went out and helped Ted Cruz. We went out and helped so many people. And I'll tell you what, if we didn't do those 32 rallies, and it wasn't easy, when you're doing rallies with 25, 30,000 people, in Texas, we had 109,000 people sign up. We used the Houston Rockets Arena. It holds 22,000. Tens of thousands were outside. We were sending notices, please don't come. That's a little different. Usually people are begging, well, yeah, like, can somebody come? We never had an empty seat. Of course, the Washington Post, a guy named David Weigel, he wrote an article, some arena, no, listen to this. He wrote an article. He got there 4 hours early. He took pictures of an empty arena. He then put out a note, something to the effect, not very good crowd size, Mr. President. And I never saw it because I don't follow the guy, but thousands of people that were in that arena that was packed with 25,000 people outside that couldn't get in. He got there 4 or 5 hours early because he doesn't fly private, you know. And maybe it's because of the carbon footprint. You think maybe that's, maybe it must be the carbon footprint. He just doesn't want private. But he got there hours early. And, you know, the place hadn't started taking in people. They weren't going to take them in. So there were virtually nobody. And, you know, whatever it was, 18,000, when you have nobody, it's a little scary looking. So he took pictures. And you know who really got even? Our people. Because they were incensed. We had people sitting on the stairwells. We had people sitting in every seat. I don't think we've had an empty seat since we announced. And from the day we came down the escalator, I really don't believe we've had an empty seat at any arena, at any stadium. It's been an incredible thing. And that's why I say this has never, ever happened before. And now we have to verify it in 2020 with an even bigger victory. And by the way, just to finish that story, Chris, the great Sarah Huckabee and Mercedes, who is incredible, sitting right here. Mercedes, thank you. They always say, you know, they're good people, right? Much better than I am. They always say, don't bring it up. Don't fight. Don't fight. Everyone understands. I said, they don't understand. If I don't explain it, how are they going to understand? So remember the empty arena one, right? And then it was shown, and the Washington Post had to do, and this particular writer had to do I thought he was going to get fired. I mean, if that were a conservative, he would have been fired on the spot. He would have been humiliated for what he did because it was fake news. Nobody was in the arena. There were thousands outside, but they hadn't opened the gates yet. They did the same thing at our big inauguration speech. You take a look at those crowds. And I watched one of the evening shows that are ridiculous, how horrible they are, how mean, how horrible. And I watched it by mistake. And they showed. They showed from the White House all the way down. They showed from the they showed there were people, nobody's ever seen it. The Capitol, down to the Washington Monument. People, but I saw pictures that there were no people. Those pictures were taken hours before, right? And they always mention crowd size. He talks about crowd size. So I'm constantly bugging Mercedes whenever we have a slow moment. I say, Mercedes and Sarah, show them the pictures. Show them and compare them with what they put on television. Those pictures were taken hours before. And remember this also, not that Obama would ever do this, but we had fencing all the way down to the Washington Monument, and it was raining, and it was wet, and the grass was wet. And women and men, and I consider them totally equal, so I'm not going to say it's harder. In fact, it's probably, with the men I know, it's actually easier for the women to make the walk, right? But they had to walk all the way down. They had to walk with high heels in many cases. They had to walk all the way down to the Washington Monument and then back. And I looked and I made a speech and I said before I got on, I said to the people that were sitting next to me, I've never seen anything like this. Look at that crowd. And it was wide. Wide. We had a crowd, I've never seen anything like it. And I have to live with crowd size. It's all a phony deal, folks. But I saw a picture just the other night of practically no people. It was taken hours before our great day. That was a great day for us. That was a great, great day. People came from all over. People came from all over. So Sarah said, and Mercedes said, sir, it doesn't matter, nobody cares. I said, but I care. And people care. People care. So what I'm going to do is I'll give it to the great one. I'll give it to Mark Levin. And I'll give him the picture. And then I'll show you where they showed just the other day an empty field, like nobody on it. And you'll see the sun, you know, you can see it's very dark because the sun's like starting to rise, right? And you can have some fun. You're going to get big ratings on your show, I'll tell you that. Sunday night, everybody. Sunday night. 10 o'clock, right? Sunday night at 10 o'clock. Thank you. I knew that actually, but thank you. All right, now let's get back into what I'm here for. And don't fall asleep. Don't fall asleep, right? Don't fall asleep. You know, somebody said, oh, the speech you made, sir, the State of the Union speech was incredible. They said it was incredible. They said that was so great. And I did. I got great reviews even from some of the really bad ones out there. Of course, by the following morning, they had to change because the head people called them, what are you doing? A lot of it's not the people on television, you know. A lot of it's their bosses, which someday we're going to have to figure out why, Meadows, why that is. Because, you know, if you're building a great country, you have the best employment and unemployment numbers we've ever had. More people are working today in the United States than ever before in the history of our country. And you say, why are they upset by that? Why? Why are they upset by that? We've slashed 30,000 pages of job-killing regulations from the Federal Register. That's an all-time record in the history of the United States, even by presidents that are there for 8 years and in one case more. We passed the largest package of tax cuts and reforms in American history. And we got rid of the individual mandate, which was a big deal, which should lead to the ending of the disaster known as Obamacare. It should. The great state of Texas has a case, and it was literally based on the individual mandate. Now that it's gone, I don't know how they rule against it. Now we'll have to find out. But that'll soon be up in the Supreme Court of the United States, I hope. And we're going to see what happens. And then we're going to get together with the Democrats and come up with really great health care. Okay? Really great health care. And one of the other things we did in our tax package is ANWR, perhaps the largest field in the world, oil and gas. I got it approved. And I didn't want to get it approved for a certain reason, because I thought somebody treated me very badly. Very badly. Don't get that vote very often. And I said, you know, I don't want to get it. Then I get a call from a friend of mine, and he's in the oil business. He's not asking for anything, but he's a knowledgeable guy when it comes to oil and gas. He said to me, hey, and they all call me Mr. President. I have friends that for 35 years, hey, Don, how you doing? Hey, Donnie, I love you, Donnie. For 35 years, now they call, Mr. President, sir. How are you? I have a friend, very rich guy, Richard Lefrak in New York, builder, good builder. He calls me all my life. Hey, Don, how you doing? I've known this guy so long, from kindergarten. It's true. Hi, Don, how you doing? How's everything? Now, I get a call the other day. Mr. President, how are you, sir? How are you? I said, Richard, lighten up. Lighten up. Call me Donald. Richard, call me Donald. You've known me for, I don't want to say because I don't want my wife to hear the number. But it's true. Actually, that's true. That's actually true. Richard came up. He said, I've known your husband for 65 years. I said, don't say that. I say 20, 25, 30. Don't say 65 years. But I said, Richard, call me Donald like you always do. Call me Don. Okay, Don. Okay. He gets his breath. 2 minutes later, Mr. President. But maybe that's a good thing. That's called respect for the office, right? Maybe that's a good thing, right? Many of my friends. And that wasn't in the script either, Mark. But we're renegotiating right now horrible trade deals that we're cracking down, and we are really doing a number, cracking down on countries that cheat and standing up for the American worker for the first time in many, many decades. Many decades. Our workers have been treated horribly. A country announces they're closing their plant in Michigan or Pennsylvania or Ohio. They're closing. They're closing a plant. They're going to move to Mexico. They're going to move to China. They're going to move someplace else. They fire all their workers. And then they sell their cars. No tax. Just make them in Mexico, sell them back to here. No tax, no nothing. Those days are all gone, folks. They're all gone. They're all gone. And in the new deal with Mexico and Canada called the USMCA, it's very, very hard, prohibitively hard, for a company to fire its 4,000 workers and move to Mexico or some other location. It's now a very costly, they can do it, I guess, if they want, but it's costly, it's painful. It used to be almost, I've been talking about this for a long time. I used to say it's almost like we're giving them an incentive to leave our country. Again, I'm for America first. That wasn't for America first. And we have great companies that are now moving back to our country. They're coming back in. They're coming back in. And by the way, you know I'm building the wall. We're finishing the wall. We got a lot of money. It's in the thing. Okay. And there'll be some people in the room that don't like this. We're down to 3.7% unemployment, the lowest number in a long time. But think of this. I got all these companies moving in. They need workers. We have to bring people into our country to work at these great plants that are opening up all over the place. This was not necessarily what I was saying during the campaign, because I never knew we would be as successful as we've been. Companies are roaring back into our country, and now we want people to come in. We need workers to come in, but they've got to come in legally, and they've got to come in through merit, merit, merit. They've got to come in through merit. They have to be people that can help us. They have to be people that can love our country, not hate our country. We have people in Congress, right now, we have people in Congress that hate our country. And you know that. And we can name every one of them if they want. They hate our country. Sad. It's very sad. When I see some of the things being made, the statements being made, it's very, very sad. And find out, how did they do in their country? Just ask them, how did they do? Did they do well? Were they succeeding? Just ask that question. Somebody would say, oh, that's terrible that he brings that up, but that's okay. I don't mind. I'll bring it up. How did they do in their country? Not so good. Not so good. But we need workers. We have to bring in workers. One other thing, because we have a lot of people here that are important people in terms of votes. We have some senators. We have some congressmen. When a senator tells us that he's a free trader, so am I. I'm a fair trader. I'm a free trader. But when a senator said we can't do tariffs where we make a fortune, or at a minimum, we're able to use this tremendous power that I found. Tremendous, old stuff, nobody even knew it existed. I'm able to use it at a minimum to negotiate great and fair trade deals. They wouldn't even be talking to us because it's so one-sided. Last year we lost 800, this is for many years, almost $800 billion on trade. It's not sustainable. You can't do that. And now we're making great trade deals. But when some of the senators, good people, I think they're good people, I just don't understand the thinking. So I say India is a very high tariff nation. They charge us a lot. When we send a motorcycle to India, it's 100% tariff. They charge 100%. When India sends a motorcycle to us, we brilliantly charge them nothing. So I want a reciprocal tax, or at least I want to charge a tax. It's called a mirror tax, but it's a reciprocal tax. Now here's what I don't understand. I've had a lot of people, Lindsey Graham, I said, Lindsey, it's not his thing necessarily. It's not the thing that he's most adept at, but he's adept and he's smart. I said, Lindsey, if they charge us 100, I like a reciprocal. They charge us, we charge them. He goes, that makes sense to me. And then he gets on to judiciary and things that, frankly, he likes and finds very interesting. But he's a smart guy, and he said, I'll never forget. It took me about a minute, which is a long time. I did a bad description. It's so easy. They charge 100, we charge nothing. Now we have reciprocal, so it's 100. But what happens now for those that really think about tariffs and don't like tariffs for whatever reason it might be, and that's okay, what's going to happen is, in many cases, instead of 100 and 100, you're going to have 0 and 0, so you won't have any tariff, okay? It's going to happen. That's going to happen. But you have to start working on some of the senators that say, I can't approve this deal. I say, you know what, I want to just charge India, as an example I'm using it, but India is a very high tariff nation. I mean, nobody knows it because nobody knows what they're doing in Washington. But India is a very, very high tariff nation. And they charge tremendous numbers. So they charge 100, so I say, I'm not going to charge 100, but I'm going to charge 25%. And I hear there's turmoil in the Senate because we're charging 25. So I call a couple of the guys up. I say, fellas, listen, they're charging us 100 for the exact same product. I want to charge them 25. And I feel so foolish charging 25 because it should be 100. But I'm doing 25 only because of you. I want to get your support. Sir, that's not free trade. Where do these people come from? Where do they come from? Where? Where do they come from? I need your help. I need your help, the voters' help. Where do they come from? So it can only be one of 2 or 3 things. Number one, I know they're very smart people. I know they are. And I even like some of them. But they're smart. So we take that out of the equation. So and I know they don't have evil intentions. And the other thing could be, I guess, maybe, these companies are all owned by people. And these people are very generous. Campaign contributions, they're very, very generous people. Can that be possible? I don't think so. I hope not. Because we're talking about our country. We can't allow a country to charge us 100% and we get nothing for the same exact product. For one thing, they don't respect us. They think we're stupido. They don't respect us. But let me tell you something. The world respects our country again. They respect us. And America is now booming like never before. Other countries are doing very poorly. Other countries are doing very poorly. And that makes it even harder for us to be successful. Plus, we have a gentleman that likes raising interest rates in the Fed. We have a gentleman that loves quantitative tightening in the Fed. We have a gentleman that likes a very strong dollar in the Fed. So with all of those things, and we want a strong dollar, but let's be reasonable. You understand that. With all of that, we're doing great. Can you imagine if we left interest rates where they were? There's no inflation, essentially. There's no inflation. Can you imagine if we left interest rates where they were? If we didn't do quantitative tightening, taking money out of the market. If we didn't do quantitative tightening, and this would lead to a little bit lower dollar, a little bit. I want a strong dollar. But I want a dollar that's going to be great for our country. Not a dollar that's so strong that it is prohibitive for us to be dealing with other nations and taking their business. Since the election, we've created a number that I would have said during the campaign, the fake newsers back there would have said, this is crazy. 5.3 million new jobs, including over now 600,000 beautiful, brand new manufacturing jobs that were never going to come back to our country. These are jobs that were never coming back to our country. Remember? Not to talk badly about the other administration, but if that theory went forward with crooked Hillary winning the election, instead of being up almost 50% with the stock market, you would have been down 50%. It was heading down. It was going to be a disaster. We have nearly 5 million Americans that have been lifted off of food stamps. Nobody ever thought that was possible. The unemployment rate has reached the lowest in over 51 years, and African American, and you've heard me say this many times, Hispanic American, Asian American unemployment rates are at their all-time historic lows. And African American income has reached an all-time high. So when I'm on the debate stage with one of these maniacs, I mean, trains to Hawaii. How do you get to Europe? We haven't figured that one out yet. We don't use airplanes anymore. You saw what I'm doing in California, right? They have a fast train. The fast train goes from San Francisco to Los Angeles. It's over budget by hundreds of billions of dollars. So they have a great idea, the new governor, nice guy. Yes, nice guy. When I'm with him face to face, nice. When he speaks about me, not so nice, but face to face, he loves me. Called me up, he said, you're a great president, you're doing a great job. He actually did 2 weeks ago, 3 weeks ago. He'll probably deny it, but check the phone records. at the White House. Everybody else does. Check them. Check them. Check them. Called me up 3 or 4 weeks ago. I think they need some forest money because, honestly, the management of the forest is very bad, and that's one of the problems they have. I said, you got to get those forests. We can't keep sending billions and billions and losing hundreds of lives, more importantly. Got to clean it up. It's called management. When a tree falls, you can't let the environmentalist say you can't take that tree out. It becomes like a matchstick, that tree. It hits a flame, it goes up. The leaves, every once in a while, you have to remove the leaves because they are so... A guy smoking a cigarette, he throws it away. He doesn't mean it. The thing catches on fire. We'll lose 400,000 acres and people are killed. You got to have management. But he called me up the other day, recently, let's say 4 weeks ago or so. He said, I just want to tell you, you're a great president, and you're one of the smartest people I've ever met. That's what he said. Now, that's what he said. Will he admit it? No, I doubt it. But that's what he said. And you're doing a great job. And then he did start talking about, in all fairness, additional money for the fire, which is, it's okay. That's okay. We have great talks. I mean, I like him. Gavin Newsom, I like him. Nice guy. But they say things, politicians, they say things to your face, and then you see 2 days later they're giving a news conference. It's like, where did that guy come from? Where did he come from? But everyone in this great country, right now, because of our great new economy, is doing well, except, of course, for the never-Trumpers. But they are on mouth-to-mouth resuscitation. It's mouth-to-mouth. Mouth-to-mouth. They're hanging in there, a couple of them. I mean, these guys have gotten me wrong. Not only never-Trumpers. You have never-Trumpers, you have certain hardline. They're basically dishonest people, because, look, let's face it. Whether you like me or not, if my name is Smith instead of Trump, and if you told them I put in over 100 federal judges, it'll soon be 145 federal judges and 2 Supreme Court judges and 17 appellate division judges. That we've got the best economy maybe in our history. That we've got the best employment numbers and unemployment numbers in our history. That we've cut more regulations in 2 years than any president has ever done, whether it's 4, 8, or beyond. That we've taken care of our military with $1.7 billion. Think of that. Think of what we did. Think of what we did with our military. Think of the numbers that we have for our military. We have numbers, nobody's ever heard of these numbers before. And part of the problem that we have, because I'm a Coast Guarder, and you are all Coast Guarders, but we have to take care of our military. We have to. $700 billion we spent, and that was the first year. And then the second year, $716 billion. Now, I have no choice. I'd like to spend much less. Obama was spending much less, but our military was being depleted. He was fighting in endless wars. They never end. And by the way, as of probably today or tomorrow, we will actually have 100% of the caliphate in Syria, 100%. 100%. And we'll leave a small group of guys and gals, but we want to bring our people back home. We want to bring our people back home. It's time. Been in these wars. We were going to be in Syria for 4 months. We ended up 5 years. Just fighting. They just like to fight. We want to fix our country. We want to fix our bridges, our highways, our roads, our schools. We want to fix our country up. It's time. It's time. But I was told by a general who I had to fire, I said, General, how long before we get 100% of the caliphate? He said, sir, 2 years. I said, I can't take it 2 years. And then I flew to Iraq. First time I left the White House, because I stayed in the White House for months and months, because I wanted the Democrats to get back from their vacations from Hawaii and these other places. And I figured it would look good if I stayed in the White House so that you people all love me and vote for me, okay? I figured it would look good. So I stayed in the White House. And I'll tell you what, I was there. I told my wife, go to Florida, enjoy your Christmas. I stayed for Thanksgiving. I was in the White House for a long time, months. I had cabin fever in the White House. But if you've got to have cabin fever, that's the place to do it, okay? But I was there, I don't know, for a number of months, through Christmas. I spent my New Year's all by myself. Don't cry. It was me and about 500 men and women outside with machine guns. I never saw so many beautiful-looking machine guns. I'd look at that equipment, I'd say, man, they sit in the trees, they sit on the lawn. I told people, I'm in this massive, people don't know how big the White House. First of all, it's one of the most beautiful places in the world. I made a lot of money with luxury. This building, it's in 1799, which of course, when President Xi comes, I say 1799, like it's old. To him, that's like a brand new house. In China, they go back 8,000 years. So that's like a new residence. But I sat in the White House for months and months, except I took a day off. I flew to a lovely place called Iraq. And I flew at night, and I got there at night, and I said to myself, this is interesting, because they say, sir, all of the lights in the plane, sir, are going off. I say, why? Because we're getting ready to land. We're an hour out. I said, what about the shades? Well, we want it better than that. Maybe light gets through. So we turned the lights off, put the shades down. This is a big 740, Air Force One. And we're landing, and I go up and I look. And I've landed. I like to sit with pilots. I respect people that know what they're doing. And these are the best in the world. I really do. These are the best in the world. And the pilot says, sir, we're landing in approximately 1.5 minutes. I say, but there's no runway. No, sir, the runway's right up there, sir. I say, I don't see it. I have pretty good vision. At least for my age, I have good vision. I guess for my age, I have great vision, but I don't have vision like a 35-year-old captain. He said, no, it's right up there. I said, I'm sorry, Captain. How about this? Should we lift off and try to get Captain? There's no runway. Anyway, no, he said, right up there. And we land. There's practically no lights. These are little pin spots. And I said, think of this. We spent $7 trillion in the Middle East, and we can't land a plane with the lights on. 20 years later. How bad is that? No, seriously, how bad is it? How bad is it? $7 trillion, and we have to fly in with no lights. But I met some incredible people. Generals. One of them came from Syria, the operation in Syria. And I was upset with my generals because they weren't getting it finished. I want the job done. I want to bring our people back home. It's not fair. And this is why I flew. So I met generals I didn't know. General 1, General 2, General 3. I mean, these generals, there's no person in Hollywood that could play the role. These guys are like perfect people. I said, what's your name? Sir, my name is Raisin. What the hell kind of a name? I said, Raisin, like the fruit? He goes, yes, sir, Raisin. What's your last name? Kane, Raisin Kane. I said, you gotta be kidding. It's true. Raisin Kane, I just made him a big star. Just like I did with Mattis when I said, we're gonna give you a new nickname, because Chaos is not a good nickname. So we changed his name. Called him Mad Dog. But it wasn't working too well. Mad Dog wasn't working too well. So what happened is I flew to Iraq. I wanted to meet the people on the site because I learn more sometimes from soldiers, what's going on, than I do from generals. I do. I hate to say it. And I tell that to the generals all the time. But I didn't have to go there. I didn't have to go there because I meet, and I landed this airport, the most incredible thing. We must have spent $3 billion building it. It's one of the reasons I don't want to leave Iraq so fast. I said, how do we leave this thing? So I have Raisin Cain, 3 other generals, colonels, sergeants, and I said, bring the cameras, I'm going to make a movie. This is the most incredible thing. And I said to the generals, listen, we got to get out. I want to know, why is it going to take 2 years to knock off 2 or 3 or 4%, which is what we had left? It won't, sir. I said, tell me why it won't. It won't, sir. If we attack them in a different manner, we can do it much faster. Okay, General Raisin Cain, how fast can... Sir, we can have it totally finished in 1 week. I said, 1 week? I was told 2 years. 1 week. That's right, sir. We're only hitting them from a temporary base in Syria. But if you gave us permission, we could hit them from the back, from the side, from all over, from the base that you're right on right now, sir. They won't know what the hell hit them. They won't know what the hell hit them, sir. And I said, why didn't my other generals tell me that? Why didn't they tell me that? I said, did you tell them that? Not our place to say it, sir. They come in from Washington, sir. We have to take orders. You're the first one to ask us our opinion. True. It's true. 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 So I went back and I said, I'm going to get back to you soon. Raisin, I think you're great. I like you, Raisin Cain. But I did say, I said, well, hey, listen, we're in Iraq. Isn't that very far away from... I was here in a very short time, sir. I flew right in. Of course, he's taking a plane that goes 2,000 miles an hour, you know. But incredible. What you learn from being on the site. My father was a builder. He always used to say, nobody ever got rich by sitting behind their desk. It's true. It's true. He'd say, you got to be on this site, you got to be with the contractors, you got to see if they're ripping you off. You got to collect every nail that's dropped, every piece of wood, you can sell it. You got to be on the site. You got to see while they're building, while they're under construction, is that wall straight or if it's crooked? And you have to fix it before they build it, not after they build it when you rip everything down. True. You don't get rich by sitting behind a desk, so I didn't want to do that. And I'm in the White House and I was lonely. I said, let's go to Iraq. And I had a hell of a meeting in Iraq. And I'll tell you, those generals, not just Raisin Cain, General Cain, those generals were great. They were great. They knew their stuff. They were gung-ho. And it is true. I mean, you talk central casting, these guys, you couldn't, I mean, it's incredible. They had a master sergeant there. I could take him right now, bring him to Hollywood, make a military movie, and he's the star of the movie. That happened once before, you know. That did happen once before. Remember? They brought a man in, a sergeant, a drill sergeant, to teach some actor how to be a drill sergeant. The drill sergeant was so incredible that he ended up starring in the movie. And he should have gotten the Academy Award, by the way, but he didn't. That's because Hollywood discriminates against our people. You know the movie I'm talking about, right? What was that movie? You know the movie. But while we're making great strides, and our country is doing as well and maybe in many ways better than it's ever done before, Democrat lawmakers are now embracing socialism. They want to replace individual rights with total government domination. Just this week, more than 100 Democrats in Congress signed up for a socialist takeover of American health care. Their radical government-run plan, if you call it that, would lead to colossal tax increases, increases like you've never seen before, and take away private coverage from over 180 million Americans. And we have some great private coverage, and we've initiated some incredible plans like the new cooperative plan, where you get better insurance than Obamacare for a fraction of the cost. But perhaps nothing is more extreme than the Democrats' plan to completely take over American energy and completely destroy America's economy through their new $100 trillion Green New Deal. Under the Green New Deal, which somebody described as a high school term paper written by a poor student. It's true. It's true. Who would believe it? It's so bad. But I'll be honest with you, folks. I said, it's Saturday morning. I said, Matt, should we do a little more, spend time? He said, yeah, would you do that? By the way, everybody okay? I haven't seen anybody leaving. I haven't seen anybody. I know one thing. If Mark Levin gets up and leaves, I'll finish very quickly, because then I know. But I haven't seen anyone leaving. Nobody's left. I watch those doors. Because a lot of times, well, one time the press said, people left. Yeah, you know where they went to? The bathroom, and then they came back. 2 people. They showed 2 empty seats in a stadium of 19,000. They showed 2 empty seats. The people left right in front of me. And I said, oh man, maybe this isn't a good job I'm doing. Then they came back. They went to the bathroom. And a certain fake news deal showed a picture on the front page of these 2 empty seats. They said, Trump had empty seats. We never have empty seats. The Green New Deal would completely abolish the American oil, natural gas, coal, and nuclear power industries, of which we're now the leader in the world. We're the biggest now in the world because of moves that I've made. Happened over the last 2 years, by the way. And we're trying to speed up pipelines in Texas, which would have taken 15 years. We think we're almost very close to getting them approved. When that happens, we'll go probably another 30 to 40%. We need pipeline approval. We're going to have it very quickly. It was going to be a 14 to 15-year process. We should have it done. We'll pick up 30 to 40% more. Their plan would remove every gas-powered car from American roads. Oh, that's not so bad. They want you to have 1 car instead of 2. And it should be electric. Okay? So tell people no more cars. No more cars. I think the auto industry is not going to do too well under this plan. What do you think, Meadows? How's this? Will the auto industry be good? I don't think so. It's not looking good. I think maybe you're going to see some bad stock prices if that passes. It would end air travel, but you'll get on a train. Don't worry about it. You just have to cross off about 95% of the world. And it would force the destruction or renovation of virtually every existing structure in the United States. New York City would have to rip down buildings and rebuild them again. I don't think so. This is the craziest plan. And yet I see senators that are there for 20 years, white hair. See, I don't have white hair. I don't have white hair. Now, I see these white hairs, long-time senators, standing behind this young woman. And she's ranting and raving like a lunatic. And these senators, yes, I agree with this. Yes, I agree. The crazy female senator from the state of Ohio, the state of Hawaii, right? She's like a crazed person. What she said about men is so bad. What she said about men is so bad. But she's standing in the hallway. And she didn't know too much about the plan because she can't understand that plan. Which probably makes her smart, actually. Now, this is the senator from Hawaii. And they're saying to her, what do you think? Well, I don't know how people are going to get to Hawaii, but I'm in favor of the plan. I don't get it. I don't get it. So she's in favor of the plan. But you won't be able to get to, well, we can take boats, I guess. We'll go back to boats. This is the new Democrat platform for the, and I don't want to talk them out of it. I swear, I don't. This is a killer. I got to get off this subject. I want them to embrace this plan. I want them to go and sell this plan. I just want to be the Republican that runs against them. Could that be? I'm going to regret this speech. This speech should have been delivered 1 year from now, not now, damn it. Because they're going to grit together. They're going to say, you know, this guy's really laying for us. I should have saved the Pocahontas thing for another year. Because I've destroyed her political career, and now I won't get a chance to run against her, and I would have loved it. We got to, you know, I don't want to knock out all of the good stuff and end up with somebody that's actually got talent. That would be terrible. So I do like the Green New Deal. I respect it greatly. It should be part of the dialogue of the next election. And I think it has tremendous promise and tremendous potential for the future of our country. Socialism is not about the environment. It's not about justice. It's not about virtue. Socialism is about only one thing. It's called power for the ruling class. That's what it is. Look at what's happening in Venezuela and so many other places. All of us are here today because we know that the future does not belong to those who believe in socialism. And I heard yesterday a great speech from our Vice President, Mike Pence, talking about this very subject and talking about it beautifully. The future belongs to those who believe in freedom. I have said it before and I'll say it again. America will never be a socialist country. Ever. Young Americans. I love young Americans. Speaking of young Americans, Candace, stand up. Candace is getting married. Stand up. You've been incredible. Thank you. Your whole group has been great. You're getting married. Seems like a nice guy to me. Congratulations. You've been so great. Thank you very much, Candace. Thanks. And Charlie, what a job you're doing. Where's Charlie? Where's Charlie? Where is Charlie Kirk? Because he has done an incredible job. Thank you very much, Charlie. But young Americans like you are leading the revival of American liberty, sovereignty, and self-determination in the face of left-wing intolerance, the anger, the unbelievable anger. I see it every day. Fortunately for you, it's mostly pointed at me. You have the courage to speak the truth, to do what is right, and to fight for what you believe, and keep doing it. We reject oppressive speech codes. censorship, political correctness, and every other attempt by the hard left to stop people from challenging ridiculous and dangerous ideas. These ideas are dangerous. Instead, we believe in free speech, including online and including on campus. And by the way, there's a young gentleman with us today. There's a young gentleman. I turned on my television the other day, and I saw somebody that was violently punched in the face. Violently punched. And I said, that's disgusting. By a bully, I'd like to do a lot of things, but of course we would never do that. Because if I ever said violence, they would say, Donald Trump attacked. No, no, no. Just for the media, I'm sure he's a lovely young man, just had a little temper tantrum. I've been there before with those people. I don't want to do it again. So, the man's name is Hayden Williams. Where's Hayden? Where is he? Where is he? Hayden, come up here, please. Come on.
Thank you. Thank you. So, at the Leadership Institute, we're committed to making campuses great again, and I thank you so much for bringing me up here to let me speak. It's great that I'm being recognized, and but there's so many conservative students across the country who are facing discrimination, harassment, and worse if they dare to speak up on campus. So I'm glad that we could bring this to the forefront. And I'd just like to say, if these socialist progressives had their way, they would put our Constitution through the paper shredder in a heartbeat. So, it's as important now than ever to work at Leadership Institute and campus reform, exposing these liberal abuses to the public. It's as important now as ever. And these students do it because they have a love of our nation and freedom, and frankly, a love for you, Mr. President. So if you keep defending us, we'll keep defending you. Thank you.
Stay here for a second. So, here's the one thing. I was going to call him, but I don't have to now. I see him here. But here's the one thing. I learned a number of things. First of all, he can take a punch. Muhammad Ali could take a punch. He can take a punch. Because you weren't going to go down no matter how. That was a hell of a hard punch. He was a strong guy. But you know what? You've got yourself a great lawyer. I know your lawyer. She is a great lawyer. Just tell her to do me a favor. Sue him, but he's probably got nothing, but sue him forever. But sue the college, the university, and maybe sue the state. Ladies and gentlemen, he took a hard punch in the face for all of us. Remember that. He took a punch for all of us. And we can never allow that to happen. And here is, in closing with Hayden, here's the good news. He is going to be a very wealthy young man. That's okay. Go get him, Hayden. Today, I'm proud to announce that I will be very soon signing an executive order requiring colleges and universities to support free speech if they want federal research dollars. If they want our dollars and we give it to them by the billions, they've got to allow people like Hayden and many other great young people and old people to speak. Free speech. And if they don't, it will be very costly. That'll be signed very soon. Every day we're restoring common sense and the timeless values that unite us all. We believe in the Constitution and the rule of law. We believe in the First Amendment right. And we believe in religious liberty. And we believe strongly in the Second Amendment and the right to keep and bear arms. Which is under siege, folks. They have a lot of plans. It's under siege. Be careful. But I'll protect you. I promise you that. I'll protect you. Because it all has to come through my office. And we hopefully are going to be here for 6 more years, so you're in good shape. We believe in the American dream, not in the socialist nightmare. And we believe in the words of our national motto, "In God we trust." Every day, my presidency will defend American families. We will defend America's workers, our great, great cherished workers that now we're taking care of. They're not losing their jobs. We're creating those jobs. We're not letting those companies destroy their lives anymore. We will defend the American way of life. And we will always defend America's borders, because without borders, as I've said many times before, we don't have a country. The lawless chaos on our southern border provides a lucrative cash flow to some of the most dangerous criminal organizations on the planet. Deadly cartels constantly, daily, hourly violate our borders to flood our cities with drugs that kill thousands and thousands of our citizens violently. What are these people talking about when they talk about the border? Keep it open. Keep what open? Have you been there? Have you seen? I just got back. I've been there many times. I see what's happening. I don't like it, but I have to tell you, our Border Patrol, our ICE agents, our law enforcement, the job they do, and they don't have the backup of a wall in many cases. The job they do is incredible. These ruthless cartels terrorize innocent communities on both sides of the border and spread instability throughout our hemisphere. When I was there 2 weeks ago, 26 people were killed, very close to where I was, on the Rio Grande. Sounds nice, right? The Rio Grande. Rough stuff. 26 people were killed, and they were buried right near where I was standing. And the paper doesn't write about it, the news doesn't write about it. In the last 2 years alone, ICE officers made 266,000 arrests. Think of what that means. Think of that. Arrests. I'm not talking about people coming in. I'm talking, they went out and arrested 266,000 people who have criminal records, and in some cases for murder. Who the hell wants to do that? Thank God they're doing it, because I don't want to do it. It's dangerous, it's hard, but they love our country. And they're tough people, but they love our country. including those charged or convicted of approximately 100,000 assaults, 30,000 sex crimes, 25,000 burglaries, 4,000 kidnappings, and 4,000 violent murders. These are people that ICE is going in and getting, and either putting in jail or ideally bringing them back to other countries and letting them put in jail, because we don't want them. We don't want to have to pay for them for 50 years. You want them to pay a price, but we don't want to have to pay for them for 50 years. And all the nonsense you hear about the people that come in illegally are far better than the people we have. It's not true, folks, okay? It's false. It's false propaganda. Right? One recent study from FAIR, F-A-I-R, found that illegal aliens are incarcerated at 3 times the rate of legal residents. Those are the numbers. And if you look at prison population in federal prisons, these federal prisons the number is staggering. The number of illegals, far, far, far greater than any proportion of our population. But you don't hear that. You hear like these people are the greatest people in the world. Just ask the angel moms, how good are they? Those great angel moms who are treated so badly, so badly. Incredible people. But the simple reality is that every crime committed by an illegal immigrant is a crime that should never have happened in the first place. The border crisis is also a heartbreaking humanitarian tragedy. Vicious coyotes, smugglers, and human traffickers prey upon innocent women and children. 1 in 3 women is sexually assaulted on the dangerous journey north. When I ran for president, my first speech, I mentioned the word rape. The press went after me. I couldn't believe it. I said, will it be like this always? The answer was yes. It even got worse. From day one, I mentioned the word rape. If you look at that speech, that was so innocent compared to what's really happening. That was a very innocent speech compared to the real facts. Illegal immigration is not compassionate. It's inhumane, unjust, and cruel. The media fights me on this, but I say it. Mothers who love their daughters, when the daughters are getting ready to make that 2,000-mile trek up through Mexico, and frankly, I wish Mexico would stop them at their northern border. I wish Mexico would stop them. Because, you know, they have a border. They call it their southern border. It's 2,000 miles down from our southern border. I wish Mexico would stop them. But they have their own difficulties, frankly. I understand that. We're working along well with them. And they are doing a lot of things to help us with asylum and other elements of what we're doing. But mothers who love their daughters give them massive amounts of birth control pills because they know their daughters are going to be raped on the way up to our southern border. Think of that. True story. Told to me by the Border Patrol. So true and so sad. Think of how evil that is. Think of how bad it is. Those caravans. You look at those caravans, and some are phenomenal people. But in those caravans, you have stone-cold killers. You had the interview done by some innocent person who I think is actually back there now. And what is it that you want asylum for? Why are you coming to America? Murder. She goes, what? Murder. I mean, what's going on is incredible. And when those caravans are formed, do you think those countries that we used to give a lot of money to, I've cut it way back. I've cut it way back. Guatemala, Honduras, El Salvador. Do you think they're giving us, as we say, their best and their finest? Oh, let's send our best people up to America. Let's have our best people go in the caravan so we can give America our greatest people. No, 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 no. They give us some very bad people. People with big, long crime records. People with tremendous violence in their past. Murderers, killers, drug dealers, human traffickers. They don't want to keep their good people because they're smart. It's so sad to see how stupid we've been. Border Patrol recently reported apprehending 7,000 unlawful migrants in a single week on just one part of the Texas border a couple of weeks ago. Our immigration system is stretched far beyond the breaking point. To confront this national security crisis, last month I declared a national emergency. A national emergency. And when I see these people, and they're good people, some senators, most, I tell you, the House has been fantastic. The House, the backing we've had from the House has really been, I'm talking about in the last short period of time. There's a lot of spirit in the House. And I think in the Senate too, but we're going to have to see because we have a vote coming up. And a lot of people talk about precedent. Precedent. That if we do this, the Democrats will use national emergency powers for something that we don't want. They're going to do that anyway, folks. The best way to stop that is to make sure that I win the election. That's the best way to stop that. They're going to do it anyway. They'll do it anyway. I watch them, good people, they're friends of mine. We're very concerned with setting precedent. That's precedent, not president. Precedent. We're very concerned about setting precedent. I'm very concerned with having murderers and drug traffickers and drugs and drug cartels pouring into our country. That's what I'm concerned about. And the Democrats, they're going to do whatever they do if they get into power, and it won't have a damn thing to do with whether or not we approve our national emergency. Because let me tell you, they don't like it when I say it, but we are being invaded. We're being invaded by drugs, by people, by criminals, and we have to stop it. And we want people to come in, as I said before, but they have to come in legally and with merit. Previous presidents have used their national emergency power to promote democratic elections in Belarus, to ensure political stability in Burundi, and to defend the sovereignty of Lebanon. And you know what? That's okay. Lebanon, it's good, fine. Use it. But we need it right here in our country. We have to use it for our country. Many emergency declarations have been used to protect people in faraway nations and distant lands. Now we are protecting, finally, our people, you, our people. And we are proudly standing with the heroes of ICE and Border Patrol and law enforcement. Illegal immigration is also deeply unfair to American workers and taxpayers, including millions and millions of hardworking legal immigrants. If you care about helping immigrants and care about their success, if you care about reducing poverty and raising living standards, then you must support a safe, strong, and very, very secure border. We need an immigration policy that helps all Americans thrive, flourish, prosper. We need an immigration policy that's going to be great for our corporations and our great companies, We need an immigration policy where people coming into our country can love our country and love our fellow citizens. And this includes shutting down sanctuary cities. And we want to end catch and release. We catch them, we realize they're a criminal, and we have to release them. Think of this. They come onto our land, they put 1 foot on our land. We now have to take them through a massive court trial. Who does this? Other countries say, get the hell out of here. We have to take them through court. So we catch them. We talk to them. If they're criminals or if they're not, we release them. We say, come back for a hearing in front of a judge. You know how many judges you need to do this? We have 900,000 people backlogged. That's the good news. The bad news, nobody shows up. 3% of the people come back for a trial. It's insane. Not my fault, I inherited this mess, but we're fixing it. We have to end chain migration, and we have to cancel the visa lottery. Every American, no matter where they're born, will benefit from the creation of a lawful immigration system. It is such, you talk about an emergency. Our immigration system is so broken, folks. It's so broken. It's so sad to see. It's incompetent. It's laughed at all over the world. We have people pouring in from not just the southern border in Mexico, from China. They have a baby on our land. The baby becomes a citizen. Welcome to the United States for hopefully 90 years. Okay? And then the parents come in with the baby because the baby's a citizen. This is like crazy. They used to call it anchor babies, but they don't use that term anymore because it doesn't sound nice. Our laws are so crazy, but one by one, we're finding ways. You know, they call them loopholes. A lot of our laws, loopholes. Well, I'm finding loopholes to get around the loophole, okay? Because our Congress can't act. They can't act. They just can't act. The Democrats in Congress don't want to touch any of it. Visa lottery. That's where they put in the names. They put it in a lottery. And you pick, oh, here's a wonderful person, wonderful. You know, he killed 4 people. Here's another, wonderful. And then they get in and we say, gee, that person just came into our country. He just robbed a store and killed somebody. How is that possible? Because they send us the people they don't want. Biggest form of subsidy we give to other nations. Immigration systems that prioritize the admission of those who can support themselves financially and contribute. We want people that can help themselves, that can support themselves. We have people coming in, we support them from the day they come in till the day they die. We can't do that as a country. We can't afford to do that as a country. Sadly, on immigration and so many other issues, Democrat lawmakers have totally abandoned the American mainstream. But that's going to be good for us in 2020. They're embracing open borders, socialism, and extreme late-term abortion. Weeks ago, lawmakers in New York cheered as they passed legislation to allow babies to be ripped from the womb of their mother, right up to the very moment of death. Then, in an act and a statement, the likes of which I don't think I've ever heard. In Virginia, the governor, a Democrat, stated that he would allow babies to be born outside. He would wrap them. He would take care of them. And then he'll talk to the mother and the father as to what to be done. And if they didn't want the child, who is now outside of the womb, long outside of the womb, They will execute the baby after birth. They will execute the baby after birth. And that's one many people have never even heard of or thought about. This is a radical agenda by the Democrats. And when you put something up, as was just put up before the Senate, everybody on the Democrat side votes for it. By the way, I have to say one thing. They're lousy politicians, and they have lousy policy. They have policy I could never sell if I wanted to. But, big but, they always stick together, and the Republicans don't. Remember that. Remember that. They always stick together. They vote in blocks. They have 47. We had a tremendous victory. We were given no credit. I can't go and campaign for all of the people in the House. Too many. And guys like Meadows wins by so many points, he doesn't need any help. He doesn't need. I said, Mark, you need any help? No, I'm okay. He'll win by 30, 35. They're okay. These guys, you know the funny thing? The ones that love Trump, the ones that are really the Trumpers, like Meadows, Jordan, Gates, so many of them. I don't want to, I get myself, I could just name them so many. They're the ones that win without, I mean, it's like they don't even have an election. It's the ones that sort of, they're a little shy about embracing what we're all about. They get clobbered. They get clobbered. Take a look. Those are the ones that get clobbered. But the good news is they're all starting to find that out. Just this week, Senate Democrats opposed legislation to prevent the killing of newborn infant children who survive abortions. Virtually every Democrat voted against protecting these precious babies. Everyone. They vote in groups. And we did have that great victory. We went for 51, and 2 that we didn't like got out. They said they retired. They didn't retire. They were retired. They said these 2 senators have decided to retire. No. They retired because they had like very little support. Like how about 5% and 8%? No, we did great. We had 53. We picked up in the Senate. They were going to win the Senate, remember? And I'll tell you, folks, I worked hard. I did 32 big, fat rallies. And those rallies brought us to a tremendous Senate victory so that we can continue onward with our judges and our approval. And the fake news back there, they love to say Donald Trump suffered a big defeat. First of all, we won the Senate, which frankly, judges never, hate to say it, in all due respect. For us, the Senate, far more important. I really worked hard. But think of it, we won the Senate, and we had this tremendous victory. We get no credit at all. Wait till you see what happens. They say Donald Trump suffered a humiliating defeat. I said, I wasn't running. And one of the commentators, and I appreciate it, on one of the shows where they were saying how I suffered a defeat, this commentator said, excuse me, he didn't run. Not all our candidates were exactly great, let's face it. You can only do so much. But wait till you see what's happening when I do run. And what they don't say is, Governor of Ohio, great guy, Mike was down 6, he won by 7, with 1 day, right? He was down by 6, 1 day into the election. I went out, I campaigned, worked hard, made a speech. Jim Jordan was there, everybody was there. It was a fantastic crowd, like this, and all the people in the other ballrooms that are waiting for us. And he ended up winning. He was down by 6, he won by 7. 1 day. Then we have Georgia, the governor of Georgia. Great guy. Where's Georgia? Great guy. He was losing in the primary by 10. I got a call from David Perdue and Sonny Perdue, 2 great guys. Could you endorse him? I said, let me check. And I checked him. He was a Trumper before Trump was a Trumper. And I said, I love this guy. He's down by 10. He won by 40. You believe that? I endorsed him, Mark. He won by 40. Then he had a tough race against the new star of the Democrat Party. Not Democratic. It's Democrat. We have to do that. You know, it sounds prettier when we use Democratic. I hate to say in the speech, the Democrat Party, because it doesn't sound good. But that's all the more reason I use it, because it doesn't. They should change it because it sounds much better. Rhetorically, it's much better. Much better. But then he had an election against their star, who followed me after the State of the Union address. I didn't think she was great, but she's their star. And who showed up? Oprah Winfrey, Michelle Obama, and President Obama. And they campaigned for her, and they worked so hard. And all our man had was Trump. And we kicked their ass. True. We had a rally at the airport where 55,000 people showed up to the airport. It was one hangar. They had 3 other hangars that were full. They went so far back. The problem was they gave the press, like these guys, they gave the press too good a location because the people behind them couldn't see properly. I was so angry. But we had 55,000 people show up. I said, you're going to win the election. He won the election. He won it fairly easily against their star. And now David Perdue is going to win for senator in 2020. And then we had Florida and many others. And we have a candidate, Ron DeSantis, a friend, of many of us in this room, but nobody knew he was running. He was running against, in the primary, somebody that was easily going to win. He was scheduled to be the next governor of Florida. But Ron's been great to me on the witch hunt. He's been a defender of me against these phony charges of Russia. Russia, 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 Russia. My wife said, you never spoke to anybody from Russia, darling. I said, that's right. But Ron DeSantis, I like people that defend me. You know, when people defend me, I defend them. So he came. That's why I like Mark. That's why I like Mark Levin. And I'm not sure a lot of people like him. He's tough as hell. But I like him. I love him. But then we have Florida. So Ron DeSantis is at 3. 3! He calls up, sir, could I have your endorsement? I said, Ron, you're at 3. Your opponent is, I guess, agriculture commissioner, has $22 million in the bank. His poll numbers are very good. He's up in the 20s or 30s. I said, Ron, don't make me do this, Ron. Sir, I can win. All right, Ron, here we go. Because I know if he loses, which almost never happens when I endorse somebody, almost never. Only one time, and that was because it was done in the middle of the day of the election. Nobody knew I did it. They got home, they said, I didn't know Trump endorsed him. But we really, rarely lose. But I said, Ron, don't do it. I said, all right, Ron, I'll do it. He went from 3 to 60. To 60. And then he ran against a guy who had unbelievable support. He had every celebrity going to Florida. He had money all over the place. And Ron was in there pitching, and I was in there pitching with him. And we now have a great governor in the state of Florida. And I could mention many others, other governors, many other states, but I'm not going to bore you with it. And I really think that it's incredible what we did in the midterms. I think it's incredible. Governor of Florida, governor of Ohio. Remember, you can't win unless you win the state of Ohio. We got the governor of Ohio, and he's great. Mike, we love you, Mike. As we defend American values at home, we are also defending American security abroad. We have secured all sorts of funding,
all sorts of record everything, and we will never forget our military. We will never forget our veterans. We are taking care of our veterans like they've never been taken care of before. We just got them choice, so now they can go see a doctor. Now they can go and see a doctor instead of waiting online for weeks and weeks and weeks. And we got them accountability. You couldn't fire anybody in the VA. You had sadists. You had people that took advantage of our veterans. They've hit them. They were sadists. They were sick people. You couldn't fire them. You had thieves that were stealing, openly stealing. You couldn't fire them. I got a bill passed, VA accountability. Now you look at the guy, you say, get the hell out of here, you're fired, get out. Nobody thought we could get it. For 40 years, they tried to get it. For 40 years, they tried to get it, they couldn't get it. And VA choice, they thought, for many, many decades, they've been trying to get VA choice. You could get it. Now, instead of waiting online for 2 days, 9 days, 3 weeks, people were dying. People that weren't very sick would be dead by the time they saw a doctor 6 weeks later. Now, these great veterans, if there's a big wait, they go outside, they go to a local doctor, we pay the bills, they get better, everybody's happy, and we actually save a lot of money, if you can believe it. And I got that approved after 44 years of being unable to get it approved. For our veterans, we love our veterans. And just in finishing up, as you know, I just returned from Vietnam, where I had very productive meetings with Chairman Kim Jong-un. Very productive. We get along. We've developed a good relationship, very good, and made great historic progress. And I do get a kick out of all these people in previous administrations. Donald Trump should not, under any circumstances, be doing this or that. You know, they tell me how to negotiate. These guys died. One administration gave billions of dollars to him and got nothing. And we haven't given him anything yet. I look forward to maybe doing something at some point. But I know one thing, I'm going to get other countries to give. Maybe not us, but I'm going to get other countries to give. And if it all works out, if it all works out. I had to walk, because every once in a while you have to walk. Because the deal wasn't a deal that was acceptable to me. I don't like these deals that politicians make. They make a deal just for the sake of doing it. I don't want to do that. I want to make a deal that either works or let's not make it. But the one thing we have done is we have no testing, no missiles going up, no rockets going up, no nuclear testing. We got our great people back. We got our great, great people. And that includes our beautiful, beautiful Otto. Otto Warmbier, whose parents I've gotten to know, who's incredible. And I'm in such a horrible position because in one way, I have to negotiate. In the other way, I love Mr. and Mrs. Warmbier, and I love Otto. And it's a very, very delicate balance. He was a special young man, and to see what happened was so bad, was so bad. And a lot of what I do with respect to North Korea and any success that we hopefully have, and we've had a lot, we're given no credit. They don't remember that in the last days of the Obama administration, rockets were flying all over the place. Nuclear testing was going on. Mountains were being, these are big mountains, they were being shoved over 3-4 inches. People thought it was massive earthquakes, then they found out, no, that was nuclear weapons, nuclear testing. So much. We're getting the remains back of a lot of our soldiers from many, many years ago. Mike Pence was in Hawaii. It was one of the most beautiful ceremonies. We made a lot of progress, and we'll continue to make progress. And I really think what we're doing there is very important. But we actually had a walk, but I think we had a very good meeting. In fact, when I came home, they put out a statement that actually they were willing to do much less on the sanction front. But you see, that's not what happened there. So already I think we're negotiating. And I'll tell you this, North Korea has an incredible, brilliant economic future if they make a deal. But they don't have any economic future if they have nuclear weapons. It's really a bad thing for them. So we'll see how it all goes, but I think it's going well. I think we learned a lot over the last couple of days. And again, the relationship seems to be very, very strong, and that's an important thing, especially when we're dealing with this kind of a situation. For years you watched as your leaders apologized for America. You saw that? Would you like to apologize? No, I'm not apologizing. Now you have a president who is standing up for America. After decades of building up foreign nations, we are finally building up our nation, and we are doing it with American hands, American grit, and with beautiful, beautiful American steel. We are fighting to ensure that every young American inherits the same blessings and the same boundless opportunity that our ancestors fought to secure with all of their heart, might, and soul. Now more than ever, we need the proud men and women of CPAC. And I want to thank everybody here because it is incredible. Your organization is incredible. Matt and Mercedes, incredible. You're energized, you mobilized, and you're engaged. We need your voice. We need your patriotism. We need your commitment. We need your incredible spirit. On the 4th of July, we are having in Washington, D.C., a great tribute to America. I hope you can all come. 4th of July, keep it open. We want to bring millions of people into the city, and we want people to come who love our country. Those are the people we want. The 4th of July. A salute to America. Now is the time to embrace the promise of our history. Now is the time to defend our American legacy. And now is the time to seize our glorious destiny. And by the way, I'm watching those doors. Not one person's left, and I've been up here a long time. I said, Matt, is that okay? He said, I love it. Don't leave. But not one person. So if you hear tomorrow when they read, people left. Nobody left early. There hasn't been one person that's left. But when you read it, you just say, fake news. This magnificent nation will always be the home of those who cherish life, who love liberty, and who defend the sacred rights given to us by Almighty God. Together we are one people, one family, and one nation, forever united behind one great American flag. Thank you to everybody in this room and to all of the other rooms all over the campus and all over the country. We're hooked in all over the country. Thank you very much. I want to thank CPAC. What a job they've done. What a job Matt Schlapp and his family have done in such a short period of time in bringing this to a level like it's never been before. God bless you. God bless the United States of America. Thank you very much.